difficult that can be when we're separated from school. We certainly experience that in the spring and then through the summer. And even as we're approaching the fall, we're very cognizant that this is a need. And so we're going to do our very best to attend to that. Of course, instruction is a critical part of any school system, and it certainly is for us. We are focusing on essential learning outcomes, which we've talked about many times at the board level in our curricular meetings and other things, through engaging lessons that are designed for the format of instruction in which they're presented. So if it's a virtual format then or a remote learning format, then the lessons are designed to work well in that setting. If it's an in-person format, then they're adjusted to be presented in person. The board has a commitment to equity, to embrace opportunities for diversity and to address challenges of equity. And certainly that is very critical concern in our planning for schools. And so what we are looking at there is ensuring that all students have meaningful access to the curriculum and necessary supports. And that's important. We'll be talking more about that. Flexibility is critical because we know that the COVID situation is fluid and changes quickly, and that we will make the best decisions we can based on the information before us. But we do need to be flexible. That means that we may need to change if we're starting in a remote learning footprint. We hope to move to an in-person footprint as public health conditions allow, and hopefully that is soon. However, those conditions may change and cause us to again move back to a virtual footprint, either at a classroom level or a grade level or a school level, or perhaps even district-wide. So we need to be prepared that could happen. And then the learning environment is really critical. So whether it's I keep using the word critical because all of these things are, the learning environment is essential in that it's got to be able to support focused teaching and learning with minimal distractions, whether it's a virtual framework or in person or a mix of the two. And so that's a very high priority for us as well. So these things have really guided our discussions with our colleagues on staff, with our administrative team, with you as the board. These are the most important things that we're trying to accomplish. And in saying that, I recognize that across the community, there's a variety of opinion and perspective about what choices need to be made and should be made. And I want people to know I respect that, and that we're doing our very best to make the best decisions we can with everybody in mind. So with that, our next section here, we're going to talk about the general health and safety guidelines. These are the health and safety protocols that we're putting in place. We have many of these in place now because we already do have folks working in the buildings. In the district office, for example, our buildings and ground staff are working. Many of folks in our district office team have been working on site, and so these guidelines are in place. We've also had summer contact sports activities and some McFarland recreation and play activities going, and they have the same protocols in place. But to talk in more detail tonight about what to expect in the fall, I've got two guests this evening. Kristen Strong, our district nurse, and Allison Potter, our emeritus district nurse, are here. And so they are going to join the discussion and then talk us through the health and safety protocols. So Allison and Kristen, if you could please unmute your microphones there. I see Kristen's all set, and it looks like Allison's all set. I'm going to mute mine so that we don't get feedback, and then invite you to take it away. And then just let me know when you're ready for me to click your slide.
Okay, thank you for the introduction.
Yes, thank you very much. All right, so we'll get started here. So CDC has set kind of a level of risk awareness, and the more people a student or staff member interacts with, the longer that interaction and the higher the risk of spread. So the risk of COVID-19 spread increases in the school setting, going from lowest risk to highest risk, obviously. And the lowest risk is that step where we're starting at step 2 with students and teachers engaging in a virtual only class activities and events. Moving then to our hybrid models, we have a little bit more risk, small in-person classes, activities and events, groups of students that are together with the same teacher throughout and across the school day, and groups don't mix at all. Students remain at least 6 feet apart. They don't share any objects. That means no sharing supplies, etc. And in-person, they have a hybrid virtual and in-person class structure or staggered and rotated schedules to accommodate that smaller class size. And then of course, the highest risk is where we get back to our what used to be normal. Full-sized in-person classes, activities, and events, and students don't need that spacing anymore and are able to share classroom spaces, materials, and supplies and mix between their classes and activities. Is that right? I keep rolling. Any questions?
No.
All right. So there are 4 required policies that Public Health Madison and Dane County set in place that schools have to have to make sure that we have a safe environment for students and staff coming in. And those 4 policies we'll cover over the next 2 slides and what all they entail. So our hygiene policies and procedures needed to be updated to include expectations for employees and students who have a fever or other symptoms of COVID-19, hand washing expectations, as well as necessary supplies for that, proper cough and sneeze etiquette. Our cleaning policy and procedure includes guidelines for cleaning and disinfecting frequently touched surfaces multiple times per day, guidelines for cleaning common areas between use, protocols for cleaning and disinfecting in the event of a positive COVID-19 case on site. Go to the next slide. Our protective measures include face covering expectations for students and staff, ensuring staff are provided with and wear face coverings indoors and on buses, and ensuring students and staff with face coverings are at least 6 feet from other students and staff to the greatest extent possible. And we do plan to provide masks for all the staff in the district. And we also have plans already in place to provide masks for students grades 6 through 12. And we're working with the PTO to do the K through 5 because the free masks that we can get are not really little person size. So we're working on making sure that we have that access for all of the students as well. And then our outbreak policy includes communication procedures for quarantine, school closures, and at what point we would need to return to virtual learning. All right. You guys are making this easy for me. Thank you. So our response to potentially positive cases, it's going to include things like an isolation room in every building. Each set of hospital, can you tell I came from a hospital? Each set of school administrators is setting aside an isolation area near the health office so that if students or staff are identified to have symptoms that could be COVID-19 related, they can come and be evaluated by the health staff in an area that's separate from students or staff who do not have those symptoms, just to prevent any possible spread and also to provide some privacy for anyone who's being evaluated for possible COVID-19. That space then would be used for them to stay there until they need to go home if we determine that they need to leave. Public Health is partnering with the district, sharing information about positive cases. They do notify us if we have a positive case within the school district so that we are able to notify teachers who may have been in contact with that student, families from that student's cohort, any athletics they might be involved in. They just want to make sure that we are able to get that information out as quickly as possible. And in the same vein, they're asking us to notify them if we are aware of positive cases. You know, a parent comes back from vacation and, oh, by the way, our kid was diagnosed while we were gone in Florida. Well, we notify Public Health. They are also using that to pull student data to the top of the notification list for contact tracing, so that students aren't kind of shuffled to the bottom and left waiting for several days for contact tracing. They do, when we're able to get students back in the buildings, they really want to make it possible to get the kids back without making them wait as much as possible. With public health guidelines, people in close contact will be quarantined for 14 days to mitigate spread if you're in close contact with a positive case. So they define this as being within 6 feet of a person who has a positive diagnosis for 15 minutes or more. So if Dr. Burdell has been diagnosed as positive and I'm working with him on a project, even if it's over several days, if I'm in close contact less than 6 feet for a cumulative total of 15 minutes, I am now considered exposed to his positive case. My family is not exposed
unless my case becomes a positive case. So it's not a contact of a contact, but if you've been within 6 feet for at least 15 minutes, and that can be cumulative, so not that incidental contact where they're passing in hallways, but that close contact, like a special education teacher who's working with a special education student who needs that closer contact in a classroom, that would be a higher risk. Students or staff reporting to school while under quarantine will not be admitted. So if you're a contact and you're quarantined for 14 days, or you're a positive case and you're quarantined, both of those, we will have an end date of when they're quarantined, the minimum that their quarantine can be. And if they come back to school before that time, they will not be allowed to come into the school. And then I think, Andrew, this piece is for you, the employee absences. Did you want to cover that later?
No, I've got it. I just needed to unmute my microphone.
Okay.
Thanks.
Okay.
Sorry. So with respect to employee absences, we have procedures that these are in place now, but it's very important for all staff members to monitor our own health and to make sure that if we're not feeling well, that we're not coming to school. We need to be, the district is going to be working to secure substitutes, guest teachers to help with that. And to do that proactively as well, to identify some folks who can be on call subs with us every day here in the district, so that they're not having to travel between multiple districts. When we have employees who have medical needs, it's really important that we treat them with respect and with privacy and care as people, and it's just as important that we support them in any type of eligibility they may have for FMLA or ADA or other rulings or laws that would be applicable. We also need to use common sense and just being flexible with people as needs arise, and keep in mind that we're all here to serve kids and all here to support each other, and we're certainly committed to doing that. There are some specific procedures in place for they're very similar to the ones that Kristen mentioned a moment ago, applying to students. For if someone becomes ill, if someone is exposed to someone who has been diagnosed with COVID-19, the very similar procedures apply. So we'll have all of that in place as we do this summer. And I will go ahead and, there we go, mute my mic again.
All right, so our response for an exposure is kind of similar to a positive case, but public health states know that you generally need to be in close contact with someone who has COVID-19 to be infected. This includes scenarios like someone who lives with or cares for a person with confirmed COVID-19, being within 6 feet of a confirmed case for about 15 minutes, or if someone with COVID-19 coughs on you, kisses you, shares utensils, something that exchanges body secretions. The district will require students, staff, and families who have had a close contact with someone with COVID-19 to stay home, not returning to work, school, or childcare or public places for 14 days. Monitor their health for fever, cough, shortness of breath for 14 days after the last contact with the positive case, and consider being tested for COVID-19. If you determine that you would like to be tested, the recommendation is 3 to 5 days after the exposure to minimize the risk of a false negative. And then again at 12 to 14 days, just because some folks, the viral load starts very low and ramps up, and they're more likely to catch a late positive that way. Some people have the virus but without symptoms, so the only way to know for sure is to test. So even if you have a negative test, they need to stay home for 14 days. Oh, yes, Christine?
Is it okay if we ask questions before I interrupt?
Oh, yes, yes,
Okay.
go ahead.
All right.
We can certainly do that now. There's just a couple of slides left on
Oh,
health and
sure.
safety, and I was
Oh.
planning on taking a break to ask questions for health and safety too, but whatever you prefer is just fine.
I can wait.
Okay, all right, we'll hold that thought and we'll have questions in a couple minutes.
All right. So our current health and safety guidelines include at-home screening. Our students and staff, obviously students will need parent or guardian assistance. We'll be conducting daily at-home screening for symptoms. We will be providing that list of symptoms from public health and from CDC, along with kind of a breakdown of what that looks like. fever and chills. Well, fever is 100 degrees or higher, and chills is, not just like, ooh, something creeped you out and you get the shivers, but sustained chills where you can't stop shaking. But conducting that daily before they come into school. And if any of those symptoms are positive, they need to stay home until that's evaluated. We want to minimize staff and student contact by reducing class sizes. And this is all, of course, in regards to when students are coming back into the building. So even though that isn't the case yet, we want to make sure we really have this in place in a strong way before we get rolling. Students would remain in those groups or cohorts that don't mix during the school day, and this includes lunch. So if you're talking 5 second grade classes, they each would stay in their space. Those 20 kids stay in their little room, and they have lunch in their little room, and then they go to recess separately. They wouldn't intermingle, and related arts teachers would come to them rather than them bouncing around the building or something similar to that. Students in that way will have fewer teachers as well. They won't have as much contact during the day with other people. It'll be pretty limited as much as possible to try and reduce that contact and possible exposure. Students will use the same classroom for almost the whole day. Face coverings, all MSD staff will be required to wear a face covering per the current public health order, as will students. And of course, there are certain exceptions that apply if there are health reasons that they can't. Some of our special education students, they wouldn't be able to keep a mask on, or it is such an anxiety-producing distraction that, of course, on a case-by-case basis, certain students may not be able to wear it. And then physical distancing will be in place as much as possible, as often as possible, with at least 6-foot distancing between students and staff to the greatest extent possible. And then I think one more. And then lockers and locker rooms. This especially applies to our 6 through 12 students. Those lockers that are all packed together in the hallways, we won't be using those, or the locker rooms. If you have a student in the middle school, you probably saw that they won't be changing for PE this year because we won't be using those spaces. We want to keep the kids, again, as separated as possible just to minimize contact and possible exposure. We will be allowing students to carry backpacks. When they're in those smaller cohorts, it'll be a little bit easier to do that safely without it being a hazard in the rooms when we have a full-size class. Passing times will be limited and staggered and structured to avoid larger groups in the hallway. Like Dr. Burdell was saying, that incidental contact in the hallway isn't the worst, but we still want to try to keep that to a minimum just because, people are people, and you like to reach out and poke somebody and say hi and wave, and the less chance there is for exposure, the better. We'll have students and staff will receive instruction and visual reminders regarding practices like symptom monitoring, hand washing, physical distancing, and face coverings. This will include signs in easily visible areas to help remind staff and students frequently of good hygiene practices. Disinfecting will include increasing our daily and weekly cleaning of all surfaces. And I will say our buildings and ground staff does such a good job to try and keep our buildings as clean and safe as possible. They are my heroes through flu season every year, but they've increased that even more just to really have a plan to keep these spaces as clean as possible, especially those high touch surfaces, to protect our students and staff. Our air quality, they've been working on this quite a bit. Our state minimum is a 10% fresh air intake, meaning 2 to 3 times per hour of air exchange. Ours is a 6 to 9 per hour minimum air exchange per classroom, using a 38 to 40% fresh air intake. So kudos to our crew because they're doing a fantastic job with that as well. Our water fountains and restrooms will be a little bit adjusted as well. The students won't be able to use those running water fountains, but the bottle filling stations will be able to be used. And we're working on making sure that any student who can't provide a reusable bottle, that we'll be able to help them with that. Protocols for restrooms will be a little different as well, not allowing big groups to be in the restroom so that we can maintain distancing, and then discussing hand washing and proper hygiene and frequent sanitizing. Entrances and exits will be addressed with implementation of traffic flow protocols. The administrators are already working on this, trying to the best of our ability to keep things in a one-way flow, especially as we're moving into an maybe an AM, PM kind of thing where you have students coming in while other students are leaving, trying to keep those as separate as possible without that cross mix in the hallways. Using staggered arrival and dismissal, using multiple entrances and exits instead of just those main couple of entrances at every building, using entrances that are close to the places where the students are going to be spending their day. All of our field trips have been canceled until further notice. Unfortunately, most of the places we would take our students have been closed to the public as well. So even if we wanted to take them out, it wouldn't be an option. Our events will be limited, and we'll be monitoring events for large school events and activities. Virtual events will be used whenever possible in place of face-to-face, including concerts and conferences. And then our visitors and volunteers, only invited visitors will be allowed in the school buildings to minimize that risk of spread. So if a student is determined to have COVID-19 symptoms and we're calling home to have parents come and get them, the parents will come to the lobby area, the front of each school, and then stay there once they've checked in, and a staff member will actually bring the student out to them, just to, again, minimize any extra exposure throughout the day.
So I think this is Kristen, thank you so much. I think this is a good time to pause and take questions. Yep, I know Christine had a question. Let's take her question, then we'll take yours. And I'm going to open up Allison's mic as well. And then we'll do questions on what we've covered so far, and then we'll move into building cleaning procedures and such.
Okay, thanks so much, Kristen. I have a question about exposure, especially when we move into phase 3 or any phases beyond virtual, I guess. Can you walk me through what happens if a staff member or a student shows symptoms of being ill? What happens to the classroom? Just walk me through that process. What happens next?
So if we're working in phase 3 where we have the small classes, if we have a student in that classroom who is diagnosed as a positive case, part of it depends on if they're diagnosed during the school week or over the weekend, because if they're diagnosed before they come to school on Monday, we have a little bit more leeway as to who they might have exposed the week before. But if a student is exposed and they're found to have had recent contacts in a classroom, then we'll work with public health to determine if the students are considered to be a high risk exposure where they really are considered an exposure and they need to be quarantined as well, the other students in that cohort, especially in the elementary levels. The kids are going to be separated at desks, but I don't know if you've ever tried to keep elementary students in the spots that you put them in. They have a lot of energy, and sometimes 6 feet doesn't quite make 6 feet. We're all human. We know that's going to happen. And if the teacher is working with the students, they have to help them with reading, or they have to help them with a math problem, or they have to get close to them, and they get that cumulative 15 minutes of less than 6 feet closeness over the time when that student might have been considered to be contagious, then public health will help us determine that, well, it sounds like that the 3 or 4 students closest to them probably need to be considered exposed, and they should all be out 14 days, as well as the teacher. And then they'll help us kind of make that determination. However, if a student is diagnosed as positive, I plan to address it similar to how we do with a case of strep throat or influenza, where we send out a message to that classroom families and let them know, hey, a student has been diagnosed as positive, you should watch for these symptoms. The district nurse and or public health will be in contact with you if you need to do something more than that. If the teacher were to be impacted, it would be a little different, because again, if it's an outside contact or they're diagnosed before they come into the classroom, we just need to find a sub to cover them until they can come back. If they come into the classroom and they're diagnosed after they've spent a few days in the classroom with the kids, then it's more likely that most of their class is probably going to have to be quarantined as an exposure, because especially younger grades where the teachers really have to get right in there with them to be able to assist them with things, it's just the nature of being a good teacher. There will be exposures.
Right. Okay.
Does that help a little bit?
Yeah, just a little bit of a clarification. So what I'm hearing you say is a child might go home with, looks like clear COVID symptoms, but you won't really identify them as a positive case unless they're tested positive, because they could go home with a cold or an ear infection or something and have fever and so forth. So there may be a few days though that go before you would know they were positive, and then they were considered then positive, and you would have to do the contact tracing. Is that accurate?
That's pretty close. The nice thing about the symptom control is that we have already built into our health policies that if a student goes home with a fever or, really bad coughing, things that we think look like contagious illness, we already make them stay out 24 hours until those symptoms are resolved, especially fever. So if we're sending a student home for fever, even if it's not COVID, they have to be out 24 hours without medication, fever-free, before they can come back.
Gotcha.
But yeah, so we might not find out right away, and we'll really be counting on families to be working together with us to let us know as soon as possible. And the nice thing with public health is that because this is a continuation of care, once the school year starts, they can safely call me even within HIPAA laws and let me know that you have a student who's had a positive case so that I can notify families safely. So even if the student goes home, say on a Friday, and they find out over the weekend, public health will notify me as soon as they find out. So I should find out, Monday or Tuesday morning that I have a positive case, and hopefully that student is already being kept home.
Right. So a letter wouldn't go out though until there was an actual positive case. Is that what I'm hearing?
Ideally, yes, because if you cry wolf too many times, people start ignoring you.
And all of this, if I may interject, may change as public health becomes more proactive
Yes.
with the reopening scenarios. They may, as we're discovering, students can carry this and be asymptomatic. And sometimes you're most contagious when you're asymptomatic. And so some of these exposures, when the actual positive occurs, have already, we're looking back 3 to 5 days, or a minimum, I'd say, of 3 days from what I've just read, that they may have exposed that classroom. And so I'm thinking as we go on, public health will firm up. Sometimes they'll, when there's a significant public health situation, they will be proactive in their communication to student groups, and just say, monitor your students for these symptoms.
Sure.
And
Yeah.
I think it has been my experience too, that if they can't prove that everything was good and the kids are safe, most likely public health is going to err on the side of caution and tell us to just have that whole class out for 14 days to make sure that there's no sharing of exposures.
Gotcha. Okay, thank you so much. I know that a lot of this is very fluid. It's hard to get all of these details down, but I think as a parent myself, just kind of knowing what to expect, and I know you're thinking about this, so appreciate the clarification.
Harlan, you had a question a moment ago.
Yeah, I was wondering when we talk about air quality, and I'm glad to see that we can increase our turn of air in there. My question is I got 2 questions. First off, if we're bringing in 38 to 40% fresh air, that means we're bringing in 60% of already air in the classroom is just being recirculated. And so I was wondering, in our filtration system, is it something that can have a disinfectant on it, or is it something that needs to be routinely replaced, or what we could do to try to clean the air that gets reused through it again? And then secondly, I'm also going to ask, and you ladies will probably know more about this than anybody, in a hospital situation, their ventilation is always very high. Can you tell me how that works in hospitals, how they can try to contain stuff?
Well, if the hospitals have what's known as a HEPA filter, which is, a certain filter that many of us have on our furnaces that has like a 98% similar to like an N95 mask filtration. So the hospitals use a higher tech, filtration system like to circulate air that is virus particles can be trapped, with, or a filter that virus particles can be trapped in. So, I mean, those standards of care or standards of filtration, are pre-built into the buildings. So, I mean, I don't know the cost of them, but I would think that's ideal setup for a situation where you have bigger institutions. Like I do know, I think in airports and certain buildings and facilities, they have the HEPA filtration for that particular reason. I don't know if that's exactly what you were asking.
So I can answer part of this, and then I'm guessing if Bill or Jeff is on, they're going to be able to answer the actual school building turnover much better than I can. But to speak to hospital situations, the hospitals that I worked in, our air filtration return rate was exactly the same as every other public building. The only thing except we did have those filters, like Allison said, in the actual air return systems, but we were pulling in the same amount of outside air and circulating the same amount of inside air. The only time that was different were in specially designed isolation rooms to prevent circulation of airborne particles throughout the main hospital, in which case it was a completely airtight room and their air was only circulated with the outside. But that isn't really something that we can manage in a school building, unfortunately. But as to what it means for our building, I think Jeff and Bill can probably speak to this much more fluently than I can.
Well, certainly I can jump in here, Andrew, if you would like me to. First of all, Kristen and Allison, thanks for handling some of the topics that probably normally would hit us. And I'm not sure I can be as eloquent as you guys have been with some of these topics, but certainly our HVAC system, Arlen, with your question regarding, the minimum air handling switching over and where we can take it. We've routinely already been usually at like a 30% air exchange with new fresh air getting mixed in with the air that is being pulled throughout the whole building back into the system. So I think you had mentioned the piece about that, 60% of the air in the classroom. Well, all of the air is being pulled back through the system, back through the filtration, and it's mixed with inside air and outside air. Certainly you can go as high as you want, but you're not going to be as effective over time. So that's where we see a target of being in that 38, 40%. Our systems can handle that, and we'll get a nice air exchange throughout the buildings in total. With regards to the filtration systems, Kristen is completely on, and Allison, with certain types you can put in there. We're able to put in different filtering systems, and we have been exploring those. Certainly there's a lot of people out there selling a lot of different products right now. And we're again relying on our partners at NAMI which also service many of the hospitals in Dane County, to help guide us through what will be the best setup with the filtering system as well, once we approach more people in the facilities.
Thank you. That answers my question very, very well. Thank you.
Craig, do you have a question? Craig, you're muted. Here we go. Craig, did you have, I saw you had your hand up. I didn't know if you had a question.
Yeah.
Go for it.
All right. Am I good? Do you hear me? Are we aware of, or is there any way that we would be aware of any positive that we've had amongst our students and or staff since we closed schools in March, through a current time, or is there really no way of us to have any idea what we've had?
For that, if there is, Kristen and Allison, please jump in if I've got this not quite right, but my understanding is that if there is a positive test result that public health becomes aware of through their testing system, they will alert a school. Now, whether they do that during the summer, I'm not sure because school's not in session. But go ahead.
Sorry, I did not mean to interrupt.
That's okay.
So I have worked with public health on one case. I've been working with Paul Ackley with athletes because we've been running the summer sports camps. When we left school in March and the students weren't actually in the building anymore, public health then stopped notifying us because then it's a HIPAA violation because they aren't related to our situation anymore. But with the students over the summer, we've been notified if a parent made us aware, or if the student said, I can't come to practice because I was exposed to somebody. So to date, we have, I think, less than 20 exposures and one positive case that I am aware of.
Okay, thank you. The second thing I had was if we are back in person to any degree, during our typical flu season, the October and November time frame, are we gonna treat COVID symptoms and your standard Asian flu or whatever it may be, those symptoms, and treat them both the same until we can distinguish one from the other?
As of right now, yes, that is the recommendation from public health, that we'll be looking at the general symptoms. If it's a symptom that could be a COVID-19 like symptom, then they'll need to have some evaluation. Thankfully, the flu test is pretty easy to do and comes back pretty quickly. So what a lot of the clinics were doing in the spring, because we had such a long flu season this year anyway, they were doing a flu test first. And then when we had a shortage of the COVID tests at first, they would do a flu test. And then if the flu test came back negative, then they would test them for COVID, which means the student has to be out a little bit longer if they decide to do it in a stepwise fashion. I'm not sure how the clinics will do it this year, but we will be asking them to be out for those symptoms only because we need to take the precautions. Thankfully, now with the virtual options set up, we'll be able, if those kids are out because of symptoms, but doing okay and able to participate, they could certainly jump onto the virtual learning platform and be able to interact. So.
Yep, that's kind of what I thought. Let's see. There's always the potential for both staff and students over the course of a year, if you're once you go to either a hybrid or an in-person type model, how are we going to handle multiple exposures with, say, the same teacher or the same group of students? If you get more than one, if you get 2 or 3, is there a benchmark or a point where we do something differently other than just quarantine them and have them come back at the end of the 14 days for these multiple exposures?
This would probably be a good one to answer in 2 parts, Craig. Kristen, go ahead and start, and then Jeff, from an employee perspective, if you could jump in on that too, it would be helpful.
Thank you.
So from the information we have right now, which of course could probably change by tomorrow, we would continue to quarantine them if it's becoming a multiple class where, the second grade class keeps getting, poor second grade, I keep picking on them. The second grade class gets sick and then they're out and then they come back and then another kid has it. Well,
right.
That may be something where we would look at if that same class is continually over and over. I would be working with public health then to make the determination that Maybe that class needs to be virtual, but for a little bit to get them over the hump. Or look at public health then would look at doing an investigation of outside factors, because then it might not be something that's just us. Maybe there's something else going on in the community. So that would be something we would be in contact with public health pretty regularly, because especially if we're seeing repeat events with the same classroom, especially the same students, frequent exposures, that kind of thing, that maybe they don't ever have a positive case, but the same student is exposed repeatedly. That's something that public health would be helping us determine as well, to do some more investigation. I don't know that that exactly answers your question.
No, that's fine.
Okay.
No, maybe Jeff could chime in a little bit on, from a staffing perspective, how multiple exposures might affect that.
Well, and that's certainly, I'm going to say right up front, that's going to be a challenging question to answer. But if in the case, I'm going to kind of flip it with, if we have a teacher go out and is ill, and, if we're still operating that classroom, if public health puts us in the position of, keep moving forward, let's say all the, kids are seeming fine, and then we bring the teacher back and the teacher goes out again. I mean, we're certainly in a situation where, probably asymptomatic students and an adult that isn't is testing positive. Craig, I'm not sure I can actually honestly answer that, because when we have a case with a teacher, it's similar to students, we're going to be relying on our medical professionals and public health to guide us through the process of our employees not being at work, and then going through the procedure of getting them tested and jumping into the FERCA laws and having a substitute teacher involved if that classroom is deemed to move forward, or if that classroom is deemed to be virtual, then that would be the situation.
Okay. Now, I know these are all going to be difficult things, and you'll probably be tackling things as they come up.
And Craig, and we've had 3 employees that have come to us during the summer that have said they've been exposed, and we've put them through the protocol and gotten them tested and, brought them back. And granted, we haven't been working in a situation where these employees are working with kids necessarily. They're out and about with other adults, our cleaning crews, our technology department. So, we've been using the protocols that have been put in place as best as possible with our employees.
I think those are really good questions, though, Craig. I think those are things that we're all thinking about and a little bit worried about. If you find a crystal ball that helps with that, could you let me know?
I want to just chime in. Of course, I think at the point when you start to have multiple exposures in one classroom, it's not going to be just limited to one classroom. I think it's going to reflect the community spread in general, not necessarily McFarland, but the greater, region.
Sure.
So I think when you hit that point, the metric will also probably be an alignment where they're going to make a decision, at a public health level.
Yep.
And I also just a thought similar to what the university is doing, and at some point, I don't know if this, is where they're taking, getting people in for a period of time and then breaking, to allow the dust to settle and people to sort through any symptoms or no symptoms, and then trying to, resume that, like a Christmas break or Thanksgiving break, so there's, natural points in the school year that could be used to people's advantage in general if something like this would start to, ramp up again.
Yep, for sure. Kristen, if possible, could you go over briefly the 15-minute exposure guidelines that you went through before? I think I might have missed a little bit of that. If you can do it, fairly briefly.
Sure. So the way they've described the 15-minute exposure I used me working with Andrew. So if Andrew and I have been working together on a project over several days, Andrew is diagnosed as a positive case. Well, my time with Andrew is really only a few minutes each day.
Sure.
But if we look at it, in my time with Andrew, within that 6 feet, I'm less than 6 feet with him. If it totals over those 3 days that he might have been contagious, at least 15 minutes, then that's considered an exposure, because I've had significant cumulative exposure that I could have breathed in enough of the particles to have a viral load that would cause me to become COVID positive.
Okay.
Because there is some thought that if you have just, a small 1 or 2 droplets, that your body might be able to clear that, is their thought right now. So that 15 minutes gives you an exposure high enough that you're likely to actually get sick.
So even if you're exposed 3 different times over a period of 3 days for anything more than 15 minutes cumulative, then that's going to be considered an exposure.
Correct. And that's where it gets really tough, especially with teachers, or, once we're getting back and we have the special education assistants working with students, because they've got that side by side with them, and they might be side by side, but, it doesn't stay that way. And a few minutes here and a few minutes there, and it kind of adds up. And if they can't say it was less than 15 minutes, then they'll be considered an exposure. Oh, you're muted again.
Go ahead.
You'd think that folks would err on the side of caution when it comes to times like that.
That would be my recommendation. I think that the district is pretty on the side of protecting our staff and students as much as possible. So I would think that we would err that way.
Certainly. Thank you very much.
Yeah.
And I just want to add that this 15-minute contact is irrespective of whether a person's wearing a mask or not, or not wearing a mask. It's, what I mean? You can't really assume that the mask is going to provide the lower exposure risk.
Sure.
Does that make sense? Okay.
Yeah, no, absolutely. Thank you very much.
Could I jump in on that point just for a second, Allison and Kristen? The mask I'm wearing tonight is not a PPE mask, in that it's not an N95, it's not a respirator, it's not a surgical mask. It's just a face covering that is designed to protect other people from me. When we're working in the health office, our health services staff will have different PPE that has different ramifications for close contact. Kristen or Allison, would you mind talking about that just for a moment? So I'm thinking that there might be some folks who are watching who are wondering how our school nursing staff and our school health staff who are going to be working with people who are not feeling well are going to stay safe themselves.
Yes, we actually asked this at one of the public health calls specifically because we had some concerns about this. The goal for the health office staff is to have a little bit more towards actual hospital level PPE. As of right now, health staff will not be using N95 masks. The biggest limiting factor with that is that you have to be able to be fit tested for them on an annual basis. And most hospitals, public health definitely, and emergency management do not have the staffing capability to be able to take on all of the health staff in the county from the schools. So at this time, they are not willing to do that fit testing. So even if we could get them, and they're being reserved pretty much for hospitals right now, we wouldn't have access to get fitted for them and to do the training to apply them properly. However, we are going, the plan, the goal is, and I believe, I'd have to double check with Lauren, but I'm pretty sure that this is our plan, that the health staff will have an actual surgical mask, which gives you a little bit more protection than just a face covering. And then when we're actually working with students, we have to also have goggles or a face shield in addition to that mask, so that our eyes are protected from any, oncoming droplets, and we're covered with a surgical mask. If we have those requirements and we are in contact with a student for 15 minutes, we are not considered exposed because our PPE is considered to be enough that we should be protected from the virus at a different level. Did I answer that? well.
Thank you. Appreciate that. Lauren, I saw you just turned your video on. Anything to add?
No, I just wanted to agree with Kristen with what the plan is for health services staff and the PPE that they will have access to.
Great.
I was
Thank you.
hoping I
Lauren.
remembered that right, Lauren.
There's a lot to it, as everybody knows. Let's shift gears if we could, and let's jump over to building cleaning procedures. There's some operational pieces here. There's some more operational things a little bit later in the presentation, but I'll turn it over to Jeff to talk about building cleaning, and then we'll pause again for questions when we need to.
Okay. Well, certainly building cleaning procedures are very important, and these are very general and broad in nature. And we have policies and procedures in place for how we have to move through the buildings even right now. But just, keep in the back of your mind some terms. Disinfecting means killing all germs. Sanitizing means reducing germs to an acceptable level as judged by our public health standards. And cleaning is removing visible dirt, debris, germs. And what's really important is the fact that all of our staff that are involved with this and all of staff that will become involved with this will be trained with public health guidelines, but also the MSDS and user guidelines for those products that we will be using. We certainly use all certified EPA and FDA disinfectants. And wipes and hand sanitizer will be available for use by staff and students as they come at whatever stages we have this year. Common area procedures, common areas and frequently touched surfaces will be sanitized throughout the day, disinfected at least once per day, but more so whenever we have a changeover of students. So if we did, with the AM and PM session idea, we would have disinfection going on in between, two different classes. And then I think the next slide, Andrew. Again, I've touched on that, classrooms at least once per day, if not multiple times, depending on how we move children through those buildings. Teachers having access to the hand sanitizer and the wipes throughout the day. Buildings and ground staff will have primary responsibility for disinfecting. Other staff will be supporting our sanitizing and cleaning as well. That includes our food service staff. We'll be having them involved heavily throughout this process, and they're very, they do that all the time. They're sanitizing and cleaning throughout their preparatory times for food service when we're in normal business, including then the tables and stuff like that. Students will use individual materials, so sharing, I'm not sure it'll be limited, but it'll be avoided. And if they are shared, then we'd have to increase time between to disinfect and sanitize as necessary to move kids along with their learning opportunities. Just some more information in regards to, according to the CDC, schools should close off areas used by individuals that tested positive for COVID-19 and do not use those areas until after cleaning and disinfecting. So if we did have an area, we would be shutting down an area before we get in there and disinfect before then we turn that over. Closing off areas visited by ill persons, opening outside doors, windows, and using ventilating fans to increase air circulation in the area. Again, waiting 24 hours as long as practical before beginning and disinfecting. Cleaning staff will also clean and disinfect all areas such as offices, bathrooms, common areas, shared electronic equipment, like tablets, touch screens, keyboards, remote controls. I don't think we have any ATM machines, so we're not going to worry about that one. So as much as we can hit the high areas, the high touch areas, the common areas, we will. part of the reason why schools in at least step 3 of this plan, where we won't have as many after school activities or any, is because our custodial staff that would normally be in the evening will be around during the day, and on the clock working throughout the day. So there'll be many more people in each building during the day than just right now. We just have one chief custodian in each building during the day. So that's an important switch with why we're able to support during the day activities of education and not so much the after school activities.
Thanks, Jeff. Before we transition to teaching and learning, are there any questions for Jeff about facilities cleaning and procedures of that kind? Okay, if we have questions later, we can certainly take those, and let's turn it over to Melissa. And she and Lauren will be talking about teaching and learning priorities and goals and what our instructional program will look like.
Thank you, Andrew. On the next slide here, you will see information that Andrew highlighted at the beginning of this presentation. As we're thinking about the 2020-21 school year, we're really focused on the social emotional learning for students and making sure students have an opportunity to make positive connections and relationships with the students in their class and with their teacher throughout the school year. We're also focused on prioritizing the essential academic learning for students in their grade level. And as we approach that planning, we're focusing on an accelerated learning framework. Now that may sound like advanced learners or gifted and talented, but it's something slightly different. The research that we've used that has been shared with school districts across Dane County in our collaborative meetings references an accelerated learning model as one that focuses on the assets or the strengths of students as opposed to their weaknesses. So at the start of the school year, a student who's entering 4th grade will largely have 4th grade learning and assignments given to them right away at the beginning of the school year, as opposed to starting by remediating and going back to 3rd grade learning that may have been missed or impacted by school closures in the spring. We're going to start with grade level concept and skills, and then we'll work to provide scaffolds and supports as needed to support their learning along the way. And that's what an accelerated learning model will look like. Along with this planning for increased focus on academic standards and grade level material, we will return to our standard grading practices as opposed to the slimmed down report cards that we used 4th quarter of last year. I'll turn it over to Lauren for the next slide.
All right, thank you, Melissa. So there are some special considerations that we have to think about for our students with IEPs and 504 plans. One is learning environment. No matter what step we're in, we always must consider a student's least restrictive environment. Another consideration is what accommodations and direct services are needed for that student to access the general education curriculum. IEP and 504 teams will determine those services for each individual student. So those are individualized by the team for each student. Evaluations, annual IEPs, and 504 plan development meetings will continue to be conducted and reviewed in a timely manner and in accordance with state and federal laws. Lastly, school teams have already given special consideration when determining caseloads in order to best meet each student's unique needs, taking into consideration spring's school closure.
We'll also continue to support the needs of our advanced learners as we plan for back to school. And no matter which step we're in our process, the goal remains the same for students to have opportunities to grow and be challenged in their learning throughout the school year. In addition to providing them with academic challenges, we'll make sure to support the social and emotional needs of our students and rethink about how we're supporting students across the entire spectrum of learners in our school building, and think about ways we can proactively plan lessons so that they are meeting the needs of more students within the classroom from the beginning, as opposed to trying to add on services at the end.
There we go. Let's pause there for a moment. Are there any questions right now for Melissa and Lauren?
I have a quick question. Maybe I missed it. had some questions from community or parents regarding even in step 2 where things are mostly virtual or distant learning. Do we have any kids coming back in that phase? Special ed or folks that need like really that direct teaching?
We'll have some slides in a little bit that will get at that in more detail, but the short answer to that is perhaps.
All right, thanks.
Anne? Go ahead, Anne. It looks like you have a question. Oh, you're muted. You're muted,
Yep.
Anne.
Okay.
There we go. Okay.
My question was whether we've seen an increase in IEP or 504 plans after March and all of this, online learning went into place.
So we haven't seen an increase of families asking for special education or 504 evaluation, and partly due to the fact that in the spring, we had to put a number of evaluations on hold because part of the evaluation process is testing a child in person, right? So we give a number of standardized tests and we weren't able to do that. So we currently have about 25 initial evaluations that are on hold that we need to get to when we can see students in person. Now, those are, a lot of them are at the early childhood level. So when birth to 3 refers a child when they turn 3 to us, then we are evaluating them. So I would say, I believe about 18 out of those 25 initial evals are 3, 4, and 5-year-olds. So it's our very young population, which is a very typical time that we would be evaluating. So at this point, I have not seen an increase in families reaching out for those services, but I expect that that may change.
Thank you.
Craig, did I see your hand a moment ago with a question?
Yes, actually, I think I'm probably looking more to piggyback on what Tom brought up just a few minutes ago. I know a lot of the communication that I've been receiving from folks out in the community has, once we had indicated that we were going to start in a fully virtual mode, had a great deal of concern for these students that are very young, are kindergarten through, say, maybe second grade, kids on IEPs and the 504 plans, special ed kids. That, I think, is maybe the biggest concern that I've seen to this point, is that we're not going to find a way to meet the academic and social needs of these, especially younger kids, when it comes to virtual learning. And I was hoping that we could find some way early on to see if we could teach some of these youngest kids and some of these kids with specific needs in an in-person kind of situation. And I didn't know if that's even being looked at this point. Just curious.
Yes. So Craig, like Melissa said, the next time you see me talk will be specifically addressing an answer to your question. So more to come, I would say, about what that might look like for some of our students.
That's perfect, Lauren. That's all I would be looking for. And hopefully folks that are tuning in tonight takes that to heart. These are things that we are concerned about, obviously, and it's something we're going to look at moving forward. Thank you very much.
Thanks, Craig. Let's, in the interest of providing some more information on that specific question that you and Tom shared, let's review our steps for reopening. And when we get to step 2, there's some more information in there that I think will be helpful for that question. So just as a reminder, last week, the board approved our framework for the gradual reopening of schools, which is a stepped or phased, if you will, transition, starting with bringing our staff back into the buildings to prepare for teaching. Step 2, which is where we will begin with instruction in September, is fully virtual instruction provided by McFarland educators with some virtual in-person supports in a virtual framework, which we'll talk about in a few minutes. Step 3, the next step would be a hybrid or blended learning model where all the students are in attendance in person for about 50% of the time and attending remotely for about 50% of the time. And the reason that that structure is there is, if you recall at the beginning of the presentation, I talked about the, the public health requirement for schools to maintain 6-foot distancing between students and among teachers and students. And so this is where that 6-foot spacing is really what drives this structure of having about half of the students in the school at any given time. As public health conditions improve, we'll be able to transition from that hybrid limited attendance structure to a full in-person attendance in a student cohort model. And student cohorts are groups of students who everybody's in school at the same time, but our students are grouped in one very familiar example for many people. This would be if you think of an elementary classroom, a homeroom in a grade school. That's a community of about 20 to 23 or so students, sometimes a little less than that, maybe a little more than that on occasion. And those students stay together as a group and don't mix. And so that is what helps us mitigate the risk of spread and exposure. And then the last step would be traditional in-person attendance where student cohorts are no longer required. And that is essentially what school looked like before we closed in March. Important to note, and we'll say more about this as we go through, but individual buildings may move through the steps at different times throughout the years for a variety of reasons. Public health requirements and guidance will change as we move through this situation. That may mean that some students may come back sooner or later. And there also may be some instances, we talked earlier about the potential for exposure or risk of a positive case, which may mean a classroom or a grade level may need to transition from in-person to virtual. Another important point to make here is that 4K, 4-year-old kindergarten, operates on different requirements from public health, different rules than K-12 does for schools. And so 4K operates under the childcare requirements, not the K-12 school requirements. And we'll talk more about that later, but just that distinction alone may also impact the ability for 4K students to start in person at a different time than some of their older colleagues may be able to. So the criteria for moving between steps are based on internal indicators such as the health and safety protocols being in place here at school, staff and students being trained on those. Monitoring staff and student health is very important. The idea of not relying exclusively on Dane County public health data, but also looking closely at our own internal data is very important. That was brought up last week as we were discussing the framework. And of course, consultations with Dr. Merwin, who's our district medical advisor. The public health indicators we look at are, of course, the public health orders and guidance. I mentioned those requirements that were released on July 15th by public health. We're looking at forward Dane metrics, including the new cases and the 14-day average of new cases. We're looking at 14 days. And community spread, lab reporting, timeless, and contact tracing is important. Those are the metrics that I shared at the beginning of the slide deck. And then also additional metrics may be developed by either local public health or by DHS at the state level. It's been shared by our local public health officials that they are working closely with DHS to develop guidance to help school districts across the state be more fine-tuned in their decision making and in having metrics to guide their decisions about how to reopen schools in their own communities. And so that should be coming hopefully soon. And we will incorporate that into our indicators when that's available. Moving from step 1 to step 2. So step 1, recall, is staff only, and it's really preparing to teach. And so the goal there is for staff members to be comfortable as possible being in buildings preparing to teach students. And so in order to move from that to beginning our teaching, it's as I mentioned earlier, it's training in district health and safety protocols, training in the McFarland virtual plan framework, which we'll talk more about in a moment, and then everybody having access to the instructional technology needed to implement remote learning. For moving from step 2 to step 3, that's going from remote learning with limited in-person supports to a hybrid model where everybody's in school 50% of the time and everybody's learning remotely 50% of the time. Again, these are the metrics we discussed last time, and they will continue to be refined. But looking at all the Dane County metrics being reported for the previous week, that the Dane County orders themselves would allow us to move to a hybrid attendance model. That the new cases in 7-day average shows a 14-day declining trend, at least, and the community spread and lab reporting timeliness are yellow at least. That internal indicators of student and staff health are acceptable, and of course, all of this in consultation with our district medical advisor, that Dr. Merwin would support that change moving from one step to the next. Moving from step 3 to step 4, again, that's a hybrid model, 50% attendance roughly to full in-person attendance. The metrics are very similar. One thing that's different is while lab reporting and contact tracing remains at yellow as a minimum, we're looking for community spread to be green in the forward Dane metrics at that point. And community spread is an indicator of, is calculated in part by cases where in the contact tracing process, the source of the exposure cannot be determined. And so that means that there is spread of the disease happening in the community that can't be attributed to a source, which can then be isolated, which can then help reduce further spread. And so right now, community spread, as I mentioned earlier, is still, as of last Monday, which is the most current information we have, is still at red. So there's still a much higher risk of community spread right now. And again, continuing to monitor the internal indicators of student and staff health and consulting with Dr. Merwin. I mentioned this a couple of times tonight, but it's important to review that we may need to move backwards through the steps, and that while we have committed to providing families and colleagues with at least 2 weeks advance notice of moving forward in a step, if there's a situation where we need to move backwards in the steps process, which could be at the classroom or building or district-wide level or a grade level, that decision is going to be made very quickly in consultation with public health based on changing conditions. And so it's similar to increasing restrictions around public health. So just to be aware that that is part of being flexible that we need to do. We do have some specific return indicators here that we're looking at, basically working our criteria in reverse and what that could look like. And again, all of this is very important that we'll be in constant communication with the public health department and with Dr. Merwin. Looking at step 1, as I said, the goal here is for staff members to reacclimate to working on site. Many of our colleagues have not been working on site since March when schools were closed. Schools are open. Schools are not closed by order in the same way that they were in the spring. Schools reopened after, on July 1. And so our goal here is to help our staff become as comfortable as possible in preparation for teaching virtually to begin with some in-person supports, and then eventually teaching more in person. And so I've mentioned this a number of times, so I won't repeat myself, but the training pieces in that are important. I would like to take a minute and talk about what our expectations are for staff in step 1, and also acknowledge that childcare is a concern. It's a very pressing issue, not just for our educators, our colleagues in the district, but also for the community as a whole. And I don't want to make light of that. It's a very big challenge. Our expectations for staff in step 1, which is again preparing to teach, are to work on site as needed to prepare for the beginning of remote instruction or as directed by the direct supervisor. And I want to be clear about why it's worded that way. It's important in order to become comfortable working in a new environment, it's important to be in that environment. And it's also important to recognize that we need to be flexible with colleagues, both with their own unique situations that they may have, including their own family childcare situations, but also recognizing that as much of the work that we're doing is going to be done remotely or virtually, a lot of the prep work might be done that way too. And so we want to be flexible for that. When colleagues are working on site, they have the option of attending team meetings in person with distancing and face coverings and the other health procedures in place, or virtually if they prefer. You can, for example, we're having a virtual board meeting in many respects tonight, and Arlen and I are here in the same room participating virtually with you. We're seated about 8 or 10 feet apart, and we're both wearing a face covering. And so that something of those lines could very well happen as folks are getting ready to teach. And then the other notes that I've talked about quite a bit about training and procedures and things. Also, I do want to mention that per the Public Health Department face covering order, if an individual is working in a room that is closed, that has a closed door, and they're working alone, they can remove the face covering and not be in violation of the order. When we're working with other people in a confined space or in an open space, then the face covering needs to be worn. And I do want to continue to emphasize that the district will make reasonable accommodations for staff members with documented underlying conditions. In terms of childcare, recognizing that childcare is a challenge, we will, if staff members so need, we will allow staff members to bring their school-age children with them to work during stage 1. That's before teaching begins. There are some things that need to be taken into account for that. Obviously, a child's presence in the school cannot impede the educator from participating in their work, in their meetings and so forth, in their prep work. And also that there are confidentiality requirements that need to be maintained. So any discussion of an individual student that needs to happen, a child who's in the building cannot be present during those conversations. If there are staff members who have children at home during the day and they need to leave on them to leave school periodically to check on them, we're certainly happy to accommodate that. We will also consider staff members' requests to work remotely when there's a short-term emergency childcare need. Of course, if a teacher is teaching remotely, then those confidentiality policies still apply, and we need to make sure those are being followed. If staff need to make those arrangements, we're asking them to communicate that with the building principal as soon as possible. Also understanding that in an emergency situation, that doesn't always afford itself a lot of advance notice. So the idea here is we want to be we want to be as flexible and supportive for our staff members as we possibly can in support of student learning. And so, in developing this framework here, both with our administrative colleagues and then with MFT leadership, we feel as a group that this hits a good balance. Our MFT colleagues were very supportive of this framework when I met with their leadership team last week. And one appreciated the district's consideration of the need to be flexible, and also understanding that we all have responsibilities that we need to meet as employees as well. So with that gets us to step 1, and that's in many ways what August normally looks like, in that teachers are coming back to prepare to teach students who will return within a short period of time. So the next step will be step 2, which is McFarland virtual plan with virtual in-person supports. This is the piece, Craig, I'll come to your question in one second. This is the piece of the presentation that I think will speak to Tom's and Craig's questions about how do we provide in-person supports even when we're in a virtual framework. So before we move on to step 2, Craig, how can I answer your question?
Well, over the course of the last few weeks and maybe even few months, you hear a lot about being creative or thinking out of the box, kinds of things to address some of these very, very prominent issues that pop up in terms of having to be on a virtual mode. Again, way out of the box, but has anyone thought about, or has anything even be considered toward, well, I should back up. Maybe it's not possible to do. Some of the larger organizations around town provide their own daycare for staff that's working during the days. And I'm just wondering if that might be possible, or is there potential for possibly setting up an area where we could do in-house childcare for our teachers while they're working? Again, out of the box.
Well,
trying to be creative.
That's a very good thought, and we are investigating that. We're seeing if that's feasible to do. That would most likely involve a third-party provider supporting that service on site here with us. I don't have a definite answer for you on that if it is able to be done yet, but we are investigating it, and I will certainly keep the board updated on that.
Thank you very much. Just a thought.
Yep, very much so. All right, Christine.
sorry, I was trying to unmute. I'm sorry I didn't catch this earlier. I would have asked a question about it earlier. Why the distinction of children who are school age, as far as bringing in, you know, a baby or?
Yep, that's a good question. So that is consistent with what other districts who are supporting staff in this way are doing, and the some of the logic behind that too is that typically if a staff member has a child that's not of school age, they have childcare arrangements already in place or would need to make childcare arrangements already for students who are not going to be attending school, and so that's with where childcare is particularly challenging. It's all challenging. Where it's even more challenging, perhaps, is in supporting childcare for students who would normally be in school. And so that's some of the thinking behind that. Now, again, as I mentioned earlier, we certainly are going to be receptive to supporting staff members with unique situations. And so, you know, I think it behooves all of us to use common sense and be flexible where we can. And support each other as we need to support our kids.
Yeah, because I could see cases where, you know, and certainly I've seen it with you know, the staff that I work with childcare centers closing, or elderly parents have been taking care of babies and are not able to. So I appreciate that the administration and individual principals would be willing to consider those types of cases. I also appreciate the way it was said. I think you said, or on the slide it said, I have it up on my other screen here, that those arrangements, thank you, staff should make the arrangements with the building principal. And, you know, I appreciate that our educators are professionals and that they will make these arrangements, and that it's not necessarily something that the administration would say no to, that it would be something that if the professional is able to do their work in a way that they're able to make it work, that the administration would not, you know, would say no to that. I guess my point is that I feel like we really need to respect the professionalism of our educators right now and be really flexible.
I appreciate you saying that, Christine. That's exactly the way we tried to approach crafting this language, and it seems like, based on the conversations we've had so far with our at least with our MFT leadership group, that it's being received that way. So, you know, I think the key to all of it is good communication among colleagues to just understand what challenges present and how we can work together to address them.
Yeah, thank you.
Thanks. Let's jump ahead to step 2, which is how we will be starting instruction this fall. And I'll turn it over to Melissa.
Thanks, Andrew. Step 2 is the McFarland virtual plan. And this mode of instruction is different from what we did in the spring. You'll have a chance in a moment to hear from building administrators who will give more details about what step 2, step 3, step 4, step 5 will look like in their context that is developmentally appropriate for their students. But I want to start by highlighting 3 important ways that MVP, or the virtual plan that we have planned for this fall, is different from the experience that students and families had in the spring. The first important difference is that students will have scheduled opportunities to interact in real time with educators and each other via Zoom or another video conferencing platform at least 4 days a week. Students can count on those interactions. They'll happen on a set schedule that will be communicated with students from their teachers. And expectation for us will be that students do attend those times. If students are unable to attend, we're going to ask that families reach out to the school or to the teacher to let them know that the student will not be attending that day, much like what we would do in an in-person setting. And we'll be reaching out to families if they aren't attending. So we'll take attendance in Infinite Campus, and we will reach out to families to figure out if we can brainstorm ways to get them more engaged in the educational sessions that we have planned. If students cannot attend class, they will have access to the content asynchronously or at another time. But if they're participating that way, they won't have access to the live interactions or the benefit of those conversations that we're so missing in the spring, that we're really looking forward to providing this fall. The second important way that this will be different, still on the previous slide, is that we will have explicit teaching of expectations for virtual learning for our students. Normally, when we start the school year, we have explicit teaching of how to do the lunch count and say which lunch you would want, explicit instruction on how to move through the hallway, what our expectations are for those times. This year, we'll have explicit instruction on how to access Canvas, which is our learning management system, and how to be a successful and engaged online student. That's as independent as humanly possible for the age and developmental readiness of the student. We'll be starting that for all students at the beginning of the school year. The third thing that I'd like to highlight is that if we're operating in step 2 for an extended period of time, more than 2 weeks, we're going to schedule regular opportunities for families to get materials from school. This might include books. For our youngest learners, they read short picture books and they need lots of them because it takes a lot of practice to get good at reading. Our older students also might have small groups that are all reading the same novel, and we need access to be able to give those students and families access to those materials. So we will schedule regular opportunities for families to come to school and do low or no contact pickups of those materials so that we can support the educational needs of our students. A fourth way that our plan for this fall is different is on the next slide that Lauren will highlight, and those are the virtual in-person or VIP supports that we have planned.
So Craig and Tom, I'm hoping this will answer some of your questions and to families who have been asking similar questions. So as we learned in the spring, one of the biggest challenges with virtual learning is that not all of our students were able to access the different components of their education given a fully virtual model. And this could have been for a variety of different reasons. And so it's with that in mind, we would like to offer to a small number of students virtual in-person services or VIP supports. Virtual in-person services will be determined by a building student support team. So that is a team that is already established and has been established for a number of years that work with teachers for students who are having trouble in the classroom. So it is the very same team that will work together. That team will review student data from both the fall, so upcoming fall and last spring, in order to know which students may need this support. So kind of what Melissa just highlighted was that we are going to be doing a lot more explicit teaching about how to access virtually than we were able to do in the springtime. So we want to give everyone a chance to learn a new system and see how they're doing before mandating or asking people to come in for in-person services. So all in-person services will first take into account student and staff safety, right? That is our number one. And knowing that these services will not be available if public health does not allow for in-person instruction, which was the case in the spring. We were not allowed to do any in-person instruction. So if in-person services or supports are offered, it may look like a structured study hall where a small group of students are working on their synchronous lessons with a study hall monitor available for questions. It may also be time with the teacher. It is going to be very individual. So it's important to note that students will not attend full days. So it's most likely that if students need in-person support, it would most likely be less than 2 hours per day. Some virtual in-person services will also be available for students with IEPs. Again, these services will be for a small amount of students who are not able to access their special education services virtually. In the spring, we did find that a number of students with IEPs were very successful with virtual learning and had more access to their special education staff than if we had been in person. So we know it's a wide spectrum. We had some students very successful virtually, and we had some students who are not as engaged as we would have wanted. So that is why it's a very individual decision. So for students with IEPs, it will be up to the IEP team to review the student data to determine what services may be needed in person. It is possible that a student may only need one of their services in person a week. So an example could be that a student, one of their, say, 5 services is physical therapy. And physical therapy possibly for that student does not translate well virtually. So the IEP team would meet and determine, PT, that specific service for this student is needed to be in person for 30 minutes a week. And so that student would then come in for 30 minutes a week to receive their physical therapy. So in-person services may be provided at school, or it may be provided in the home, depending on the IEP team and what they determine is needed for that student to be successful. So those are our in-person services and supports that we are thinking about. We are developing specific criteria for teams to really look for, and also an opportunity for families to share their concerns about what virtual learning might look like for them, for their children.
Let's pause just for a moment. Tom, Craig, I know this was a particular topic of interest for you earlier. Do you have any questions for Lauren about this particular slide that we've just presented?
I'm happy to hear that we're going to offer, these limited virtual in-person supports. I think that's crucial. These are critical needs by our probably youngest learners for the most part. And I would certainly hope that spots, be they few and far between for these virtual in-person supports, that you would hope that students who are more inconvenienced by virtual learning rather than having an inability to learn, those aren't necessarily the students that we want to avail this virtual in-person support to. We want to make sure that it's the kids in special ed, the kids with IEPs, the 504 plans, that kind of thing, that are probably going to need this type of service the most. But I certainly appreciate all the efforts you're putting in here on the front end. I think that's going to answer a lot of concerns that have been coming from the community in general. Thanks very much, Lauren, Melissa, your whole crew. I'm sure there's many, many, many people working on this virtually as we speak. So thank you very much.
Anne, you have a question?
Yes, thank you. When would parents, when could they expect to learn where their student is going to be come September 1st?
What do you mean about where?
Well, I guess talking about this particular group of children, for example, when will parents learn what kind of supports their student with an IEP might receive?
Lauren disappeared from my screen for a moment, so I can do my best here. I heard her mention earlier that because we're doing some explicit teaching of expectations and tools for accessing online learning, that we are going to try to start the year with students in this MVP process before beginning directly with the virtual in-person supports, because we might find that students are more successful with that explicit teaching and with the Canvas learning management system. I also know that IEP teams and case managers are looking at the supports that are in IEPs already to identify which supports might best lend themselves to a virtual model and which ones are really going to need to be offered through the virtual in-person services. And so those teams would make the connections with individual families to let them know the schedule and the quantity of services that will be provided to them. Oh, she's back. This is good news.
We had a Zoom, something happened and Lauren was disconnected for a moment, but now she's back.
Lauren, I did my very best impression of you, and I think I did okay, but you may want to clarify. Anne's question, if you didn't hear it, was When would students learn about what VIP services are available to them as individuals?
I think it would depend on the age of the student. You know, with our students with IEPs, our case managers will be the first line of contact there with families. For our other students, you know, similar to what we do for students who may need interventions, is we try a number of things prior to a restrictive service. I think the important part to think about these virtual in-person services is it's actually a very restrictive intervention, right? Like, we have to consider what it's like for the student down the street to potentially get on the bus when the neighbor student isn't getting on a bus to come to school, and what that may feel like. So this, while it seems like it could be a great support, and I think it is going to be a great support for some students, it is still a highly restrictive support. We are removing students potentially from their homes, or we're going into a student's home to provide a service which makes the potential for them to look very different from their peers. So it's just something we have to be very cautious about. And so it just is going to be in communication with some families and the students, depending on what those needs that they're showing are.
Okay, so these students will have a teacher who will reach out to everyone in the class saying, you know, on the first day of school, we're going to meet at this time. Is that kind of what I'm understanding?
So for the MVP step 2, that is for all students, students will know from their teacher before the first day of school, these are the times that you can count on for our synchronous learning opportunities, and those will be scheduled and consistent for that student in that homeroom.
I think that's the scariest part of this, is not knowing exactly what to expect. And particularly if a student has some special needs, it's, you know, very obviously, you understand, anxiety provoking for the parents to, you know, want to know that each child is going to get the help that they need. So thank you very much for your answers.
I have a couple questions, maybe 3. So it sounds like we did get some feedback, at least on students in the spring. Will we identify those students already that have had difficulty in the prior setup? I know this is different, but will they be identified and find a place where they can learn with some in-person instruction? And then my next question is there any thought to bringing younger kids, say K through 2, back, you know, as a group, maybe before, you know, so maybe that would be a step 2A or 2.5. And then my last question is, have we identified any families who need technology help? For instance, either they don't have access to internet or high-speed enough internet, or they might have several kids in, you know, different classrooms and only one computer or something of that nature. And if you want to help remembering those questions, let me know.
I did write them down, Tom, so I might have them. So the idea of students who struggled in the spring, and are we going to keep a closer eye on them or make sure that we're reaching out to them very quickly in the fall? I'd say yes. We are, again, hopeful that explicit teaching of independence will really help them be more successful this fall, but our building student services teams and administrators did know which students really struggled in the spring so that they can keep an eye out for those students. Our VIP services, Lauren really spoke to maybe the special education students who might have access to those services. They wouldn't necessarily be limited to students with IEPs. There might be other students who are able to access those services for any number of reasons that they're not successful being an independent online learner. And so those lists of students who struggled in the spring could include students with IEPs or students without IEPs. The idea of potentially having a different schedule for students coming back to school for our youngest learners. When we get to our presentation by Mr. Nelson, I'll let him speak to that a little bit more. But again, the short answer is yes, that is something we've considered, but we would want to make sure that we're still following the steps and the guidelines and the safety protocols that the board has approved and that Andrew's laid out in terms of the criteria that we have for moving between steps. But I think, again, Mr. Nelson will be able to speak to this more, but all of our teachers, I think all of our teachers for K-12 really know the value of in-person learning. And we really do want to get back to in-person learning as safely and as quickly as we can. But our safety of students and teachers is at the front of our mind as we make those decisions. I think your third question, and I see Mr. Mahoney here about technology support, so I might let him take care of that question.
So Tom, one of the unique things that our school board and administration have done over the last almost 12 years has moved to a one-to-one opportunity for our students. So every student K through 12 is issued a device, that being a iPad or a Chromebook. So that's number one, first and foremost. If there's a family of 3 or 4 kids in a household, there'll be 3 or 4 devices in that household. Now, when you speak to, connectivity, wireless access, we did have several partners in the spring that we were working with to get help for students. And when that help did not come through from some of those larger companies, we were investing in wireless hotspots with US Cellular, our local US Cellular in town of McFarland here. And we've actually already ordered a few more of those devices so that we can support not only our students, but sometimes our teachers are also in some predicaments as well. The learning management system is certainly a whole different platform that is designed to be, excuse me, very light on the wireless needs. So should also prove to be very beneficial. So I think we're rolling into this coming fall in a very good situation. Again, we have our tech support team that was helping families when they had connectivity issues, when they had issues with their devices, broken devices. So we went through, a real quick change in the spring, where as a school district, we came together and found different solutions. And, we do expect that we'll have hiccups with people's needs, and we'll adjust and get them the support they need.
Thanks.
And Tom, I want to circle back to the idea of students who struggled in the spring and that they may be eligible for virtual in-person supports. The first goal of those virtual in-person supports would be to teach the independence and to have the student be able to access their learning independently again. So if a student is identified for that support, it's not meant to necessarily last a whole quarter or a whole month. It's meant to bring the student in, show them and teach them the resources that they need to be independent, and then have them return home so that they can keep learning independent of that extensive or restrictive support.
Thank you.
So similar to step one, we have tried to articulate some expectations for staff and acknowledge challenges with childcare. The staff expectations they're very similar in many ways from step one to step two. Our expectation overall is that we're teaching scheduled sessions remotely from the classroom or as directed by the supervisor. We spoke earlier about flexibility with all of these things, and so that's very important. Participation in scheduled team meetings, et cetera, can be done in person or virtually while on site as preferred by the staff member. Individual work can be done on site or off site at times directed by the staff member, particularly individual prep work. health and safety protocols, face coverings, distancing, et cetera. The same clarification in the previous slide about a mask and not being required to be worn when you're in a room by yourself. And certainly we're making reasonable accommodations for staff members with documented underlying conditions. Childcare, what in a teaching scenario, was a little bit different in terms of supporting staff, having children with staff while they're teaching, because of the confidentiality that needs to be maintained while teaching is happening. So certainly staff members who have children at home and need to check on them, we can certainly accommodate that. We will certainly consider staff members' requests to work remotely when there's a child care need that way. And we're obviously, when that happens, the teacher is still responsible for following student confidentiality requirements involved in teaching. And so again, we're trying to set expectations that apply generally, and knowing that we need to be flexible to support our colleagues in that. And as in the previous slide where we were talking about staff expectations, staff should make arrangements with the building principal with as much advance notice as possible on unique circumstances. And again, understanding that when there's emergency, that often belies the opportunity for advance notice. So again, communication among everybody is what's going to be key to pulling this off successfully. And just knowing that, just want to send the message that we support our staff. We're all here to support our kids and our community, and you know, we want to work with people as best we possibly can. So step 3 is the hybrid learning model, and that is a future step for us as public health conditions permit. The goal there is to provide in-person opportunities for everybody with social, emotional, and academic learning. Virtual in-person supports, or VIP supports that we talked about a few moments ago, are for a fairly small group of students. When we transition to a hybrid scenario, that's everybody in for about half a day. And then we switch. And so the other half of the student group comes in for the other half of the day. We will be, we're trying to be really, really cognizant of not having our teachers having to manage 2 systems simultaneously. That's really a lot to ask of anybody. There's going to be some need to support, you know, virtually and in person to some degree, but not to have that full expectation of, I'm teaching 2 distinctly different curricula, one in a virtual setting, one in in-person setting, and managing 2 classes at once. That's just not practical or realistic. And so, you know, one of the things that's important to mention too about the hybrid scenario when we move to that step, we've had WEVA as an option for families throughout, obviously since we've partnered with WEVA, but for families for whom an in-person experience is something they're just not interested in for whatever reason that may be. And there are many very valid reasons why that might not be a good fit for families. WEVA is an option for families who are interested exclusively in an online scenario for the full school year without the transitions going in and out. So, and I don't say that I say that to offer as an option, not to, you know, to push people who might not be interested in that direction, but just want to clarify that continues to be there. Step 4. And we've talked a little bit about this earlier, but step 4 is the next, after public health conditions continue to improve, we can have the entire student body in person, attending in cohorts that don't mix. I've spoken to that already to some degree, to some detail tonight, so I won't repeat myself on that, but that is the next step. And then step 5 would be traditional McFarland in-person instruction, which is essentially what we looked like in schools before we closed in March. And that's quite a ways down the road. That likely would require a vaccine and or a reliable therapy for individuals who do have COVID. So those are the 5 steps, and some discussion about in more detail than what we presented last week, but certainly detail we've been working on for quite some time in planning these different scenarios, depending on where we landed with public health requirements. But hopefully people have a little bit of a clearer sense of what to expect, particularly in step 1 and step 2 as we're beginning the school year. At this point, we're going to transition to each of the buildings and invite each of our building administrators to share a little bit about what does this mean at the high school? What does this mean at the middle school, at Wabisa, at Conrad, and so forth. Craig, I see your hand. Should we take a question first before we do that?
Yeah, just very quickly. I know, I don't know if it was a month or so ago, maybe a little bit longer, when we were just kind of talking about all the different options that were available maybe to school districts. And at that time, you had gotten together with virtually all, if not all, of the Dane County superintendents at least. And at that time, it seemed to me that your group had some very specific issues with how difficult it would be to really truly run a hybrid system. And I'm just wondering if any of that has changed, or if it's just become obvious that we're going to have to, at least at some point in time, go to a hybrid model despite all of the problems and issues that the superintendent's group came up with earlier on. I'll just listen to your answer. Thanks.
That's a great question. Thanks for raising that. You're correct. Earlier in the summer, this would have been in mid to late June, there was some discussion at the Public Health Department about imposing a 50% attendance cap on all schools, meaning that at any given classroom, you would not be allowed by public health order to have more than half of the students there, which immediately forces you into a hybrid scenario. And that is, at the time that they were considering that, the public health conditions were not as challenging perhaps as they are now. And there were also, given some of the other guidance that public health was issuing at the time, there were school districts who could meet all the public health requirements without limiting their attendance. And so when you think about a smaller school district with smaller numbers of students overall and smaller classes, a school district like Deerfield, for example, they could actually, given the recommendations that were in place at the time, again, this is a while ago, if public health were to impose that 50% classroom limit on a school, they could potentially prevent that school from having everybody in session in person, even though they could do that and still meet the requirements. And so the superintendent's group sent a letter to public health asking that the public health allow flexibility for school to provide asking two things really: provide clear guidance about what the best safety protocols are to put in place in schools, and to allow individual districts the flexibility to implement the best solution that made sense given what those guidance required. And so some of the things that we anticipated, and public health responded to that. They recognized that they do need to provide that level. They need to be consistent in terms of what the parameters are, but they need to allow flexibility for how school districts manage those given their unique circumstances. In terms of some of the challenges of a hybrid scenario where 50% of the students are in school in person, and then while those students are in, the other 50% of the students are learning in a setting outside of school. Earlier in the summer, we were also looking at a hybrid model that was based on students being in person for 2 days a week, a day in the middle of the week, a Wednesday, for example, that would be for deep cleaning buildings, teacher planning and preparation, and reaching out to individual students and families, and then the other students coming in for Thursday and Friday. We felt very uncomfortable with that design because that means 5 days out of 7 students are not receiving in-person instruction. And we all know how important in-person instruction is. And so we feel much better now. We still recognize there are a lot of challenges with implementing a hybrid system. I don't want to sugarcoat that. That is the most complex scenario to operate. And we feel much better about the model we've developed here, because we're basically looking at every student having in-person instruction 4 days a week for about half of a day. And so that's, and then asynchronous opportunities for the other part of the day. And then that Wednesday does still afford some opportunity for some synchronous interactions among students and teachers in special settings. And so we've improved where we are in terms of our thinking on what a hybrid scenario could look like, but it is quite challenging, and it'll be challenging for teachers. It'll be challenging for families and kids. Anytime you sort of have a foot in both worlds there, it's very difficult. So that's how our thinking, was in June and how that's evolved since then. And you're right, at this point, if we're going to do in-person instruction, a hybrid model, so to speak, is the only option we have, as long as that 6-foot distancing is a requirement in our K-12 settings.
I got you. Thanks very much, Andrew.
You bet. You bet. Jeff instead has turned his video on and is going to share a little bit about the high school.
Good evening, everybody. Thank you, Andrew. First of all, just let me say to the board, I appreciate what you have to do to make this work and make decisions. So thank you for what you do. We thank you for your support. When we go through our model, I first want to preface this by saying every person on our staff wants our students in our building. We miss them. We miss those relationships. So where we have landed didn't come easy. It was an exhaustive conversation with our building leadership team. But we've landed on the fact that we think the best thing for us right now is to commit to having all our classes meet virtually every day for the first quarter, or 4 days a week for the first quarter. When we start looking at cohorts, other things, we believe that the high school experience should be social, but should be also given the opportunity to have your electives. We felt restricted in other models where students were going to be held in a room with 17 to 20 students all day long or all morning long and then sent home. There was no social emotional learning going on there, and unable to mix. And when I say mixing, I mean traveling from one class to another class. The inability to do that just didn't sound like it was educationally sound practice, nor did it sound positive for the social emotional aspect. So we've landed on at least the first term to be virtual, so we can really take time to teach our students how to be virtual students, how to learn online, and do it right within a 9-week period of time. So whatever we face after that, our students will be successful. So to make that happen, we've decided to go to a 4x4 schedule for the whole year. And the reason we picked a 4x4 is if we change to a hybrid after the first term, we can make that transition very easy. The 4x4 most closely represents our current schedule with the 4 blocks, so our students are familiar with it. In order for them to make it really work for a transition, we had to try to find a way to get our class sizes down. So this came from our building leadership team. They decided to add every teacher, rather than teaching 3 classes a day of the 4 blocks, they would teach 4 out of 4. To make that work, we create a common planning time. So in the morning, our staff will meet from 7:30 to 9 o'clock as a common planning time opportunity. Then they would teach 4 classes a day. What happened was it really lowered our class sizes down to 17, about class average. So if we do move to a hybrid, we can handle that social distancing in the classroom. It also makes it, we think, more effective to hand over to teach on a virtual setting as well. So every day, we'll have 2 blocks that will meet synchronously. So they'll be interactive with the teacher. We will have 2 blocks in the afternoon that will meet asynchronously. So asynchronous means that we're going to have a flipped classroom and staff will have lessons planned for them. I'll explain that a little bit later. And the afternoon will be filled with office hours and interventions, so staff can reach out to students who need help and students can reach out to staff. So Andrew, if you go to the next slide, please. This, I think, details a little bit more clearly, at least the best we could put it on a slide. You can see that the first hour and a half from 7:30 to 9 o'clock is common planning time. But you also see we have music listed there. One of the keys to one of the negatives to a 4x4 is unless you do something different with the schedule, music can't meet all year long. So for this situation, for this school year only, we're going to have the music department, music classes meet before first block. That way that they can have class all year long. If we get to a situation where the second semester, third term, third quarter, we can go live. We can build those music classes right into our schedule, and they're not going to miss a beat, and we'll be good to go there. Everybody else will start at 9 o'clock. This is the synchronous time. So you can think of synchronous learning as video conferencing, live chats, breakout rooms, lectures, anything interactive where the teacher is going to actually have the students on that Zoom meeting. In the afternoon, all students will be working asynchronously. And that could be some self-guided modules. It could be streaming video, virtual libraries, posted lectures, posted notes, maybe some discussion boards, something that's going to be not with the teacher, but still something to do. I'll probably detail a little bit more in a second here. The asynchronous learning is expected to occur in the morning as well. So you see like on Monday, first and second block, that's going to be synchronous. Those third and fourth block classes do have things they can do. And so the freedom, the flexibility of this in the afternoon gives those students a chance to say, I can do the work at night. I can do the work in the morning. I have some time to work in the morning. So we can hopefully have some flexibility in the afternoons really for people to make some things work. So just keep in mind that students can complete that asynchronous work whenever it works in their schedule. So from a daily expectation standpoint, students will complete asynchronous lessons prior to the synchronous lesson. They're required to attend the synchronous lesson. They will probably have some asynchronous wrap up to the lesson. There could be some homework assigned, and then they can attend ASR when they are asked to do it, or if they need some help. Our staff is going to teach synchronously every morning, hold office hours and interventions in the afternoons, meet with students, provide possibly those VIP services that we talked about before. Wednesday you see is different. Wednesday is a student activity day. We wanted to make sure we could keep clubs and activities running, so we scheduled those to be on Wednesdays. So clubs will meet. Student services now has a whole day to try to really schedule students and not pull them out of classes, can meet students on their terms. We could have administrative meetings, meet with students. I mean, we as a staff, admin team have to call students in, or get a chance to go visit them. So that day gives some flexibility there as well. Teachers will get that time to really work on creating their lessons for asynchronous learning, update their grade books, maybe do some more small or individual instruction, and we can also do some advisory. So we think with this schedule, for this first quarter, we can meet most of the needs academically and socially, emotionally. So Angie, if you can go back again, please. So in step 3, we're going to continue with the step 2 with the virtual model, but our hybrid could be different in the sense that we can bring some hands-on classes like tech ed, family consumer science. Those classes could meet in person. We may not wait till the first quarter is over for that. We can maybe do that halfway through. If we see things are going well, that may happen. So we could do that sooner for a hybrid. The rest of step 3 and step 4, to be completely honest with you, we get concerned that the hybrid we'd create is really going to depend on if the goal is to have half the population in our school, or is it to reduce the amount of time our students mix? So we have some potential ideas when we get to that point, but we really want to take our time to focus on the virtual part, have hybrid in the sense that we can have some of our hands-on and lab-based classes meet. So that in a Reader's Digest version is what we've put together for the high school plan.
Christine.
Thanks so much, Mr. Finstead. I can't even imagine the logic that needs to go into all of this to make sure that everything is addressed. And so thanks to you and your staff.
Thank you.
So I just have a really clarifying question. So for it would be a typical 8-class schedule during a week. Is that correct?
No, 4.
4. So block 1 is the same class. So they're essentially getting 3 hours of the same class plus some flipping, or am I right?
You're going to get 2 hours of the same. Each class will meet 2 days a week.
Okay, for a total of 3 hours.
Yeah.
Yeah. Oh, okay. So plus any of the homework or the activities.
Right
And so on.
now.
Okay. Okay.
This caveat would be, even though the time is scheduled from 9 to 10:30,
yeah.
I'm hoping we're not sitting on a Zoom meeting for an hour and a half, because we're doing this tonight and we're all having a blast, right? So hopefully that
right.
There's think up our teaching strategies and do some things that will bring it up.
Absolutely. But there's interaction. Maybe you're putting them in small groups and they're talking about something or something. Okay, that's very helpful. And then where would you schedule when you move to step 3, would you put those in the afternoon then? Is that, or would they still fit into the morning blocks? I'm just curious.
Who's they?
I'm sorry, the hands-on classes, where would those classes go?
So if we just bring them in, it will fit on how it's built into their student schedule. So it'll be any of those 2 days, any day.
Gotcha. Okay. Thank you. I know it's complicated. I really appreciate it.
Thank you.
Craig.
Yes. I've got a one here that I think is probably just sort of a general, just kind of a general observation that I made through my communications with, both the community people, parents from the outside over my email. And I caught this, I don't know, honestly, if it's a fact or not, but I did hear that under certain circumstances, a 6-foot separation with people being in person in schools can sometimes be even more harmful than from a social and emotional viewpoint than being virtual. The fact that the kids are together, but they're really not, they're together, but they have to be 6 feet apart and they can't congregate in groups and that sort of thing. What I had, I don't know whether I actually heard it or read it, but that the 6-foot separation for especially the smaller kids is more detrimental to their social economic than being in a virtual setting. Number one, that I'm just asking about that. And the second is, it just, I can't get past the fact that we're going to need to bring more staff on as we kind of move along here. If we're going to be doing virtual and some limited in-house, are we prepared from an administrative standpoint to go out and find additional people if we need them? And it just seems to me that will be very difficult at this time.
So I'll address the first comment you made, Craig. You're right. When we were first looking into the cohort model of having students stay together, when you think about high school, this may shock some of us, but high school kids are going to high school for the social part of their life. That's where they see their friends. In the models that we were creating, they weren't going to see their friends. We're going to have them come in different doors, go right to their room, stay there, and then go out those same doors. So that wasn't happening, and we just landed on the fact that how are we really helping our kids? And so that's why we got off of that model. From a more staff perspective, I will say, from a high school standpoint, I appreciate the teachers bringing up the idea of teaching more classes. That came from our leadership team, trying to be creative and outside the box of how do we do this, and that was their idea. So I think we're okay with staff right now. I think we may need some support staff later. Who knows? But right now I feel pretty comfortable with where we are.
Yeah, obviously you don't have a crystal ball, and there are going to be instances moving forward we're going to be surprised by some things, but I'm confident that between all the buildings administrations and Andrew's, Jeffrey's assistants, we'll get through this fine. But I think we have to be prepared for the unknown as well moving forward.
That's fair.
I think flexibility is key, just as it is in, we talked earlier about flexibility in terms of responding to public health conditions, but flexibility with meeting the needs of our students and our colleagues is just as important. Anne, you had a question.
I do. So are there any classes that are not going to be able to be offered under this kind of plan? And secondly, when students registered for classes last semester, were you able to accommodate most of those requests like you would in a normal master plan?
Good question. To be honest with you, the other models that we were looking at would have had us not offer everything and do some combinations. This basically allowed us to run the schedule we'd always run. So what I found out today from Jackie Ginther and Beth Canfield is that we had a 99% success rate in getting courses requested. So students, for the most part, are going to get their classes. The only change really is what you heard from the English department a couple weeks ago, where we have English 11 and the senior seminar. Although, again, that's why we went to this, is the transition, either way, let students get the classes they wanted.
And when will students find out what classes they will be having?
We're wrapping up the schedule this week. We'll find a few things on small. We got to have some problems, so hopefully soon. Quite frankly, teachers are just finding out what they're teaching first term. So it'll be probably a week or so, or a couple weeks.
And obviously you weren't here when we had a 4x4 schedule, right?
Right.
But it's separate terms, but it's the equivalent of a semester, whether you might have it
right. So
first term and third term. It's just one
yep.
semester.
So I'm trying to explain a little bit. I taught in a 4x4, and we brought the 4x4 to Waupun. I'm very familiar with it. Yeah, I use the word term, and I know when I say quarter, that makes you guys understand the length of time we're talking about. But the reality is that first 4 weeks is a term. It's a half credit. It would be the same as a semester, because you're meeting every day for 9 weeks rather than every other day for 18.
Thank you.
Thank you.
Harlan has a question.
I don't have a question, I have a comment. I'm impressed. I was really kind of anxious to see how we're going to work it out, especially at the high school side too. And I agree. I think this plan, I think you guys really come up with something really good. For me to look at this, I'm very comfortable with it. I think this can really work. I tip my hat to you, because I think you got something that's we're going to have good success out of. And you opened up the door for music. And would art be also a door to be opening up or not?
Art, as far as like a lab-based class?
Yes.
Yeah, it's a possibility. Working with the art teachers, there's some questions from them actually. So yeah, Arlen, I appreciate your kind words. I'll be honest with you, the admin team we have and the leadership team we have all worked together, and I meet with the leadership team every week, and they've been phenomenal. We have a great relationship. They're very open and honest, and I'm open and honest with them. Ann and Sarah have been rock stars creating ideas. It's been a team effort, and I think we feel pretty good where we're at.
Yeah, it takes a team to make this happen.
Absolutely.
I think nice job.
Thank you.
I just have one. I have one more real quick. In terms of the tech ed department, probably a majority of those classes are kind of hands-on sort of things, whether it be metal, wood, auto mechanics, welding, any of those sorts of disciplines in the tech ed department. Are we going to be able to pretty much offer the complete schedule of offerings for the tech ed folks?
Simply answering it, yes. Yeah. What we did with the schedule was we looked at the first term and tried to put classes there that maybe aren't as hands-on, knowing that would be in this virtual situation. But at the same time, the tech ed teachers are ready to roll with virtual or online or in person. So they're ready to go either way. Matter of fact, the other day I walked into school and walked into the auto shop, and Brian Hahn was videotaping a lesson. So they're planning for how to do it virtually, but you know them, they're chomping at the bit to bring those students in.
Arlen, you had another comment.
The tech ed side has changed. I think our tech side is just phenomenal. And I think it's not the same old tech ed. And I think it's interwoven with the other departments of math and everything else. That they're really combining it to make it real world kind of stuff. And I think that's very exciting. I think it's something that we're going to be a very strong point in this district of what this tech ed is going to be cranking out and molding all the curriculums together through the tech ed part. I mean, I think it's pretty exciting.
We're on the right track.
Thanks, Arlen. Let's move to middle school next.
All right. Hello, everybody. Excited to share what the middle school is planning to do. And really, what I'm going to share with you speaks pretty well to the K-8 model. We're a little bit unique being in the middle because we do have some elective courses similar to what the high school has. Sorry, my phone's ringing. Similar to what the high school has, but we don't have that many. So the way our framework is going to work is that our students will be assigned a cohort of up to 25 kids that they stay with for the school year. So similar to what you're thinking of in a K-5 sort of homeroom model, that's not how we usually do middle school. So that's kind of a new approach for us by keeping those same kids together so they're not mixing, of course. When we're talking about that step 2 where we're in the virtual plan and in the step 3, we actually split that cohort of 25 into half. Because you know that the hybrid is about having 50% of our kids in school at any one time. So I'll tell you a little bit more about that in a little bit. In that virtual plan, our students will have that mix of sort of the synchronous learning that you've heard Mr. Finstead talk about, and some asynchronous lessons as well. The lessons on Wednesday, similar to what you've heard with the high school, and then what you'll hear K-5, Wednesday would be more of an asynchronous day where we'll do all those things that the high school talked about, maybe do some of our VIP services during that time, clubs meet during that time, following up with students that we're concerned about, and a lot of collaborative time for our staff on Wednesdays. But students will still be learning just entirely asynchronously. So the way that the synchronous part of their learning is going to be, they'll be assigned to either an AM or a PM schedule. So they're going to be, either in the morning or the afternoon. And one of the questions you might be asking, and I know Dr. Burdell spoke to this a little bit earlier, why did we pick that AM PM versus that, that 2-day sort of 5-day model, or some schools are doing it every other day? And there's a few reasons. The one that he mentioned, I think, is the most important, which is we want daily contact with our kids, that consistency for them. But along with that daily contact is it really helps them be successful during their asynchronous learning. So we're going to meet with each kid every day, and then we say, now, before we get together for class again tomorrow, here's what I need you to work on tonight. So we're trying to minimize the role that parents have, the responsibility that parents have for teaching their kids, because that's not what they signed up for. By saying in this way, it becomes like homework, is how we're kind of thinking of it, that they'll do, and we're going to see them again the next day. So they have time to do that. So that clarity about what they need to do independently is important. Also, just to be realistic, that shorter classes, we're talking about how is the social emotional impact of our kids going to be with sitting 6 feet apart from their friends wearing a mask all day. So we're trying to limit that time that we're actually in person and asking them to sustain their focus. near but apart from their peers. Classes will be about 50 minutes, and kids are going to have the same classes every day for 4 weeks. And then in 4 weeks, we rotate again. So they'll have 2 core classes every week. So maybe they'll have math and social studies for 4 weeks. And then in 4 weeks, they have science and ELA. They'll also have the related arts. So we continue our exploratory model that middle schools are known for, which means they get to try a lot of different related arts classes and see what they like. We have a daily advisory, so that's our social emotional learning curriculum. A guided study, which in the virtual model is kind of just office hours, really, but a chance for teachers to work with kids more one-on-one, and our music electives. So we're able to keep our music electives, but they're primarily going to be virtual throughout our models, partly because they can only meet with kids from within that cohort. So they can pull small groups of kids from that group of 25 and meet with them and do some individual small group sort of lessons with kids in person. But virtually, they can actually do quite a bit as well. The nice thing about this, and I'll spare you the details because schedules are really complex, you know, and Christine mentioned that earlier. They're like a puzzle. It's much more complicated than people may realize. We were able to honor a student's math placement. So that means that students at advanced levels of math are able to participate in those courses, and their choice for world language, which we didn't think we were going to be able to do, but we were pleased we were able to do that. So they'll be in cohorts that honor their math and the world language choices. So we're excited about that. Andrew, if you can advance the slide, I'll talk about what changes in step 3. So step 3, the biggest difference, it's a lot like step 2, except the lessons you had virtually are now in person. So those students who are assigned an AM are coming into school in the morning. Those who are in a PM are coming into school in the afternoon, and then just doing, you know, learning opposite that. So that flipped model that the high school is doing as well. They attend the same classes. So we're able to quickly move between these models. And again, lessons on Wednesdays stay asynchronous. Step 4 is quite a bit different. So remember, step 4, we're going away from the hybrid, and now we're full class sizes, full in person, 5 days a week. And the biggest difference for that is our classes are going to be 80 minutes, and it's a 10 to 3:30 schedule. And the reason we went with that 10 to 3:30 is, one, we gotta shrink down the time. Developmentally, our kids can only handle being in person with that same group of kids sitting 6 feet apart or 3 feet apart. In this case, it would have to be for so long. So we kind of shrunk the schedule down a little bit. But this would be the classes of, you know, maybe up to 25. They're more like 22, 23 in this step 4. So that's kind of the basics of it. I would say, if I were thinking of it from a board lens or a parent lens, much of what this allows us to do is the things that Melissa and Lauren spoke so well about, with providing those synchronous opportunities for students, being able to support them, accommodate for them, differentiate for them, that you'll hear as well when we talk with our K-5 friends. So what questions do you have for me?
Go ahead, Christine.
I don't really actually have a question. I also want to say, just as I said with Mr. Finstead, how challenging, I can't even imagine to try to make all of this work. But of course, like Mr. Finstead, you and your staff also know middle schoolers better than any of us. We don't always want to remember our middle schoolers as middle schoolers. But I think there were a couple of really good things that I saw in here. I love the idea of you switching up the classes every 4 weeks, or, you know, you're in a class for 4 weeks and then next it switches, because I think one thing about synchronous learning is just, you know, it's such a, there's only really one or two senses that you're using. So to be engaged and interested in a class for more than 4 weeks would be really hard, I would think. So I think that that's really a really great way to be looking at the schedule itself. But otherwise, I just want to say thanks again. Kudos to all of you for making this work.
I appreciate that. And we have, just as Mr. Fenstead spoke about, and is the same at K5, the amount of engagement that we get from the community and our staff, we get feedback constantly about ideas. People are always thinking of new ways to do this, better ways to do it. This is not our first plan, I will tell you. But I would, a special point in addition to our leadership team is our schedulers. So, Jeff mentioned Jackie and Beth, and we have a whole crew of schedulers that they have brains that I don't understand. I'm getting better though. Every once in a while they'll pat me on the back and say, that was good. You thought of something I hadn't thought of, because it really is a different part of your brain to do this work. It's very, very complex, but important.
Craig?
Yeah, I've got just kind of a quick one here, and it might actually be more for Jeff and or Bill Faust if they're around still. We spoke about the air handling capabilities and such in a general sense, an hour ago. Are we talking about having the ability to tweak up these air changes and keep the air in the best possible condition in all of our buildings, as opposed to just the middle school or the high school primary?
Yes, I saw Jeff Mahoney. There he is. There's his camera there. But yes, we're looking at that district-wide. Jeff?
Mm-hmm.
Yeah, all four of the facilities are in great shape for their air handling systems. Certainly the investment that the community made over the last 4 years has put us into that possibility. We might not have had that general possibility if we still had MPS, but yeah, all four buildings are operating with the air quality that we would expect, and we can tweak it and make it even better based on recommendations.
And I would assume maybe that the process will change somewhat in that we'll be checking those kinds of readings and such on a more regular basis than we might under normal circumstances.
We certainly have a wonderful energy management system that gives us that data all the time.
Thanks, Jeff. Thanks, Aaron and Brett. Let's move to K5. And so we'll have Corey and Al and Greg and Brooke.
All right. Good evening, everybody. And before we get started, just want to give a couple shout outs. First, thank you to the board and to our K5 families and our K5 staff and Aaron just kind of mentioned that too, the amount of feedback and the questions that you answer every time that we think we've got a good idea, it just becomes great. So thank you. That is just so invaluable to the process. Then also to our leadership teams at both buildings who've been meeting a couple times a week here, even in the last few weeks, giving up time, very passionate and very innovative with their ideas. So want to make sure we recognize all the folks who just have so many people that are contributing to these ideas. You're going to notice when we get into the K5 framework here that there's really just a lot of parallels to what the middle school just shared. And then one of the things that we're really proud about is that we didn't want to just think about step 2 when we were doing our planning, but we wanted to also think about how are we going to set our families and our students up for if we have to move into the step 3 or maybe even back into step 2. So we think that our plan really does a nice job of setting us up for that flow. So what you're going to notice is that we've got a cohort model very similar to the middle school, and students will be assigned to a homeroom teacher, and those cohorts will be split in half, and they'll be assigned an AM or a PM time. And if they're learning in the AM or in the PM, they're going to have 3 synchronous sessions with the homeroom teacher. And the times of those sessions will vary between 30 to 45 minutes. And the variance in that time is really just due to the age appropriateness of our students, right? Because we're talking the difference between, a early learner, kindergarten, 1st grade, all the way up to 5th grade. So we do have some variance in time. And the AM session, the range of time will be 8 to 11. Of course, we're not going to have students sitting in front of the screen for 3 hours. And then the PM time is noon to 3. That's kind of that window of time that we're looking at. And the areas of focus for those lessons will be social emotional learning, math, phonics, writing, and reading. And those will occur 4 days a week, Monday, Tuesday, Thursday, Friday. And in addition to those synchronous lessons that'll be occurring either in the morning or in the afternoon, depending on the time that students have, they'll also have some asynchronous time. So for example, if a student is doing their synchronous learning in the morning, in the afternoon, they may have an additional 1 to 2 lessons. Maybe it's a science or a social studies lesson, something of that nature. Then on Wednesdays, students will have, this is when they're going to have the related arts classes, and those will be offered both in a synchronous and an asynchronous format. It will also be an opportunity too for students or for teachers for that matter to do some outreach and reconnecting as well. And then this was mentioned before, but I just want to emphasize that again, because we know PBIS and teaching expectations is so important to kicking off any school year, and we do that every year for our students, and we reteach those things throughout the year. So we're going to still have that same PBIS mindset as we kick off the school year, and there are just going to be some added procedures and routines and so forth that we just need to go through before we really get in deep in diving into the academic learning. So we're going to move then, Greg is going to pick it up from here into steps 3 and 4. But I guess before we do that, any questions on step 2 for us?
Go ahead, Craig.
Yeah, I was just wondering if it might be at all possible when you're scheduling these cohort times, is there any way that you can coordinate those between siblings? If a parent has a 1st grader and a 4th grader, for example, or just 2 kids in that general age group, is there any possibility of coordinating cohort times between siblings?
So one of the things that's going to be coming, and Melissa, I don't know if you're still. Do you want me to address that, or did you want to talk about the survey?
You know all the answers.
Oh, I know. Okay, I got it. All right. So what's going to happen is families are going to get the opportunity to give us a little feedback here over the course of the next week. Some of that will be driven a little bit by transportation, but some of that will be family situational things. And so I think there will definitely be those opportunities that as families fill that out, just need to make sure that they're filling it out per child. Because certainly there may be a situation where you have a younger child learning in the morning, and maybe you want your older child supporting them in the morning as well, and maybe they're getting their live sessions in the afternoon. So great question, Craig, and yes, we did think of that, so thank you. Any other questions for us on step 2? All right.
All right, good evening, everybody. Great to see you all. I feel like it was maybe just a couple months ago where we were kind of sharing information like this sequentially down from high school to middle school, then elementary. And when it got to be my turn, I got to say kudos at the end. And I can kind of say the same thing right now. Kudos all around. Appreciation to you, the board members, for all of the thinking and planning I know you're doing with this. And then just like Corey, Aaron, and Jeff mentioned, just a lot of appreciation for the admin team that we're working with, but then our school staff as well, and the families and community members that we're all getting input on. So I took a little bit of my turn just to say that, because I appreciate it just as much as the next person. And Corey just finished up talking about step 2 in the K-5 framework, which again is the virtual MVP model. I just want to share a little bit about what steps 3 and 4 look like for our K-5 framework. And another kudos here, it's very in line with what we're thinking about framework-wise and structure-wise, district-wide, but just developmentally appropriate for our K-5 learners. So when we're getting into step 3, that hybrid model, basically we're taking the structure of the virtual teaching of having 2 cohorts, an AM and a PM cohort, and having them do their virtual teaching in step 2 in either the morning or afternoon, translating it over to in-person teaching, either in the morning, keeping that the same if they were in the morning in virtual, or PM likewise in the afternoon. Same days of the week as well, Monday, Tuesday, Thursday, Friday. Classes split completely in half. That structure itself right there really met one of the big priorities for our K-5 teachers. They value and want to keep sacred that relationship that they're able to build with our early learners here. And so because of that, it was worth their time and energy in the feedback we got to have to teach multiple times a day, the same thing, morning and afternoon, virtually or in the afternoon. Likewise, on Wednesdays, related arts classes are going to continue to be offered synchronously and asynchronously. That would all be virtual. So when I say synchronously for related arts on Wednesday, it would be virtual teaching. Our in-person teaching in the hybrid model would be Monday, Tuesday, Thursday, Friday. Again, the priorities of social emotional learning, literacy, and math remain the focus, continue to over into step 3 as well. Those would be the priorities for that in-person teaching during that time. But about 1 or 2 additional asynchronous lessons are going to be offered each day to our students as well. Things like writing lessons, science, social studies, etc. The lessons that we're not going to be able to get into due to the condensed time of step 3. I want to backtrack just a little bit though before I get into step 4. I know the question was raised when we prioritize in-person supports during that step 2. So back a slide even, which we don't have to go back a slide, but that's just that step 2, that virtual time. What does that look like for our youngest students? If the health criteria allow, which they would right now, and if they would continue to, we've already started brainstorming as a leadership team at the CEPS building, what that could look like in addition to the VIP supports that were already mentioned. We really would like to start getting our students into the building one-on-one with the teachers just to get to know them, perhaps even do some assessments and get some information, since for many of our students, it's their first time in a school experience or in kind of a even more structured school experience. That would be in the first week or 2 of school, even like I said, if the health guidance allows us to. And then beyond that, even after the first week or so, getting small groups of students into the building, perhaps one teacher bringing in a group of 5 students for about an hour or so, just getting them used to the routines that they're going to have to be implementing in the hybrid version. And then in addition to that, just building the in-person relationships as well. Those are things that we don't have set in stone, and there's not a plan for them, but it is a priority for us to get our young students into the building as not only quickly, but as safely as possible too. So just wanted to mention that. I kind of took a step back from step 3 into just some small elements for CEPS for step 2. And then finally for the K-5 framework for step 4, again, that's that cohorted model that is similar to the other buildings in the district. We would be combining the AM and the PM half classes into the one class. So it would, you know, in your mind be one whole class. They would be there the whole day. They wouldn't be mingling with other students. They wouldn't be going to various rooms throughout the building. The cohort model really emphasizing keeping those students together, knowing that it would be a long day for the students K-5, just like it would at the upper grades too, to be in the building in the class for such an extended amount of time. But again, really relying on the expertise of our teachers, our leadership teams to provide us feedback on how we can break up the day for students, how we can make it safe and healthy, but also a very meaningful learning experience when we get to that step 2. And so with that model, then we wouldn't be doing any type of virtual teaching. It would be all classes being taught in person, synchronously, with the addition of related arts. So that's kind of a summary of steps 2, 3, and 4 at the K-5 framework. And on the next slide, I'm just going to share some details and updates for 4K planning. So as you know, we also have our 4K partners and a valuable partnership with our district, Little Spartans, CLM, and Gingerbread House. With them being daycares and being site-based 4K places that we partner with, they actually do not fall under the same K-12 public school criteria that we do. They fall under their own separate daycare guidelines, which just has its own implications on the planning and what 4K can look like for them. Because of that, the district is collaborating with our 4K partners, especially the 4K directors right now. We have weekly meetings set up where we are just evaluating the feasibility of really 2 options as it stands right now. One of them being opening 4K in person, which you could kind of think is just regular 4K. It's 4K in the morning or afternoon, 4 days a week. That could be an option under the current health criteria. We're also exploring the possibility of opening 4K with a virtual start, similar to K-12. 4K staff are getting trained in the Canvas learning management system, just like our K-12 teaching staff are. We really want it to feel, you know, that it's not a K-12 district, it's a cohesive 4K-12 district. And so they're right in line with that. But again, like I mentioned, one of our priorities being, let's get our early learners into school as soon as and safely as we can, because that's the best way for them to learn. We all know that, we all agree on that. But then there are other implications to consider. There's the safety element, there's the training element for staff and for students. But then that third bullet point you'll see on there, another element when it comes to 4K, is we just really have to carefully consider not only those developmental needs of our youngest learners, but no matter what 4K looks like in the fall, there's going to be an impact on the community as well, especially when it comes to the childcare needs with our school district K-12 starting virtually in step 2. We have to balance multiple elements, and so we want it to be a very collaborative decision that we come to in partnership with the 4K sites. And so at this point, we plan to just continue updating you with 4K updates next week and so on and so forth as needed. So that's a wrap up of the K-5 steps 2, 3, and 4, and then just some updates for 4K planning.
Questions for Greg and Brooke and Corey and Al? Greg.
Yeah, I'm just wondering how the coordination is going to take place. I'm trying to picture in my head coordinating as a parent between a child that's, you know, in 4K and has other kids in the school system somewhere, whether it be in the primary or the middle school or whatever. Obviously, it's going to be very difficult to balance transportation needs and the differences between a 4K environment and a school district environment. And I'm just wondering, you know, how you're going about making these plans when it's so difficult to plan anything, you know, based on the healthcare guidelines. So kudos to you for working, you know, on the 4K model as well, and the additional difficulty that's going to come about because they're under a different set of requirements and restrictions. So not really as much a question as a comment, I guess. And I appreciate all the hard work that every one of you folks has been doing. It's obvious to this point there's a lot that has been done, and there's certainly more to come moving forward. So from me, just thanks very much for dotting I's and crossing T's for us. Great job.
Thank you, Craig. Christine, and then Ann.
Once again, thank you all. Thanks for your administrative and leadership teams for figuring this out. You know, I think what I'm really appreciating, what both of you said, is how much you're thinking about, first of all, the developmental needs of K-5, which I think are very different. And the need to think about the next step and how critical that is. So I really appreciate that. And then the other thing I heard with your presentation as well as others is the number of times that teachers have stepped up. So to say that I'm going to teach the same exact class in the morning and I'm going to do the same exact thing in the afternoon with different kids, I think that, I mean, that sounds exhausting to me. So kudos to them for being willing to do that. I do have a couple of questions about parents, and this is like Craig was saying, you know, where we get a lot of feedback. I appreciate the survey. I think that we shouldn't expect a family to all want, you know, maybe something in the morning. There might be needs that you need to accommodate. So I appreciate the survey. But can you talk about two different things related to parents? One is talking about how Canvas and the learning management system will work, because we're really, as a parent, needing to only understand one system, right? That's kind of generally, so I'll let you answer that. And then the second thing is, I remember when we shut down in March and April, a lot of questions about what should I be doing with my kids? Is there any thought to providing some guidance with for parents about your expectations for them? So I have high schoolers, so my expectation is go do your work and go to class and get your homework done. And I can say that. But for K-5, do you have any expectations for parents? What role do you see them playing? I guess maybe you can't answer that now, but will there be any guidance for people as you move forward? That it might be premature to even think about that.
Well, I can jump in to talk a little bit about Canvas, and then I'll maybe throw it back to our K-5 principals to answer the second half of your question, Christine. Canvas Learning Management System will work on almost any device that is internet enabled, and families and students will be able to log in. And when they log in, they'll be presented with a welcome screen that will be the same largely for all K-5 homerooms. And then it'll be a different same view for the 6-8 and a different same view for 9-12. So if you're supporting multiple students across the district, the first view that you have in Canvas will look very similar, but there will be tweaks depending on the developmental needs of the students at that grade level. For example, at the older grades, there's more text. The students are more able to read and access that information. At K-5, there'll be more images and icons and buttons to use to access that. But one of the buttons across all of the pages is a button for Learn, or for modules. For the older students, we might use that more technical term. But when they click on that, it will take them to another page that will show the directions and the expectations for that time. So it might show a video link, it might a pre-recorded video link, it might show a link to a Zoom session for where they should log on, it might have steps for what's expected for that day. But across the buildings, things are organized, you know, a little bit different depending on the developmental needs of the student. But at K-5, which you asked specifically about, the modules are going to be organized by day of the week. So when you log on, you're going to click that Learn button, and then you're going to look for whatever day of the week it is. And within that day of the week, there will be the expectations that we want students and families to do on that day. So it's very point and click. It's a system that we feel confident families will be able to navigate much more easily than the system that we had in the spring, and they'll be able to log on and use it right away. That's about the level of detail I can give you right now. We just had teachers, we have had about 40 teachers district-wide complete the training already over the last 2 weeks, and today was actually the first day for the rest of our staff to get access to the system. So we're still new in what sort of training are we going to provide families, what sort of resources will we be able to give them, but that's on our checklist for still this August to be able to have that ready for the start of school.
Well, I think just the fact that we only have to learn that one, even though it looks a little bit differently, I think is huge. So I think it's wonderful. So that's great. Thank you for the synopsis.
Anne had a question, I believe.
I do. In terms of reading at this level, way back when I had little ones, I always remember the kids would go out in the hall individually and sit with the teacher and read, so that the teacher kind of had like the running record of their reading ability. And I'm just wondering how that is done in a virtual setting. And then I also am wondering about whether you'll be distributing books to kids, and if so, would you be able to use like volunteers in the community that to drop books off at different homes? Understanding if, you know, there's a lot of kids or certain family situations where they can't come into the school, or does that raise like a confidentiality issue or something along those lines?
So I can begin on part of that, and then Greg, if you want to, or Brooke or Al want to fill in. So I'll start with your last question, Anne, thank you, around books. And I think Melissa mentioned that a little bit before. So there's kind of like two layers here that we're working to plan on. Number one is the beginning of the school year. And traditionally we've had an orientation, supply, drop off, that type of thing. So one of the things that's still in the planning works, and a lot of that's just kind of conditional based off of the conditions that we're going to be in, is having some sort of orientation per se, that would having the students coming in and you know, getting the materials, picking up. It could be that, again, depending on the conditions, that maybe they're picking those items up, and maybe they're doing that running record that you talked about as well too. So I think a lot of it's just going to depend on what happens over the next month, but those are certainly things that we're thinking about. And then I guess then there's that second layer, which would be if we continue to be in step 2, the virtual, for an extended period of time. So we are looking at having a both a pick up and drop off type situation. And then within that, we're also thinking about how we can utilize it, just kind of reallocating some of our staff for the families who maybe aren't able to, for whatever reason, aren't able to come and pick those things up, to have some of those drop off, us doing that as well. Greg, is there anything else you'd like to add to that?
Nope, certainly using volunteers to assist with that would be something we would consider if the health criteria allow it and if the need is there. And then as far as just getting accurate assessment data, like for example, the running records you mentioned, we certainly acknowledge the challenges that are faced when doing that virtually, which is why, especially when I speak for CEPS staff, exploring the possibility of getting our kids in to meet the teachers one-on-one or in small groups would be the way that we would be able to accomplish that, even in the virtual model, under the in-person supports concept of having small one-on-one or small groups of students come into the building. That being one of the reasons we would like to accomplish that if we can, the other being the relationship piece, the procedural piece, learning the routines, etc. So all good points for us to definitely consider as we continue planning.
And to speak to your point about calling students into the hall and reading with them there, we're able to accomplish that in a way virtually using breakout rooms. So we'll be able to have students in our synchronous Zoom or whatever video conferencing platform it is session, and then we'll be able to have teachers meet either one-on-one or in small groups of students to listen to them read in those breakout room settings.
Then just looping back, I don't know if Christine, if we answered your second part of your question before, you had asked about parent expectations. So I think just a quick response there is that, you know, we mentioned earlier about PBIS and for students, but that's something that now that, you know, you just heard about us, you know, our teachers are just still learning Canvas. I think once we get, that's on our kind of our bucket list of things to take care of, is, you know, once that's solidified, to figure out from a PBI standpoint is, you know, share out what that's going to look like, and sharing that with parents too, so they can help reinforce that at home. And then also giving some guidance as to how you can best support your students, which I would say is a kind of a typical thing that we would do anyways. But this is something that is just really so different and unique. So we're going to continue to, as once we get a little bit more clear about what that looks like for everybody, then we'll be able to provide that guidance.
Thanks, everyone. Let's return to Jeff, and we've got some more information about operations as we're wrapping up. It's been there's a lot to talk about. This has been a long discussion. It's certainly worthy of the time, and I appreciate everybody's concentration and sticking with it. So we're coming to the home stretch now.
Certainly, I think the next slide there, Andrew. You know, transportation is certainly going to be one of our largest challenges if we are in that phase 3 or step 3, step 4, because we will have to follow as close as we can to the public health Madison-Dane County guidelines of maintaining as close as we can to a 6-foot separation while on the bus in a horizontal setup, with the fact that the back of the seats are a high barrier. We would be able to look at probably up to about 30 kids per bus. That'd be 1 per seat. We'd have to look at only offering it to eligible riders. Couple things that we would have to look at doing is taking and migrating our walk zone for all grade levels back to 2 miles, similar to what we had in 2016, 2017. Continue to look at opportunities for more crossing guards so that we can offer some more paths for children to walk or bike or walk with their parents. And one of the biggest challenges for this community would be the fact that we've always had a strong private pay option, and that would have to be something that would have to go away. So in the May, we had about 1,200 kids sign up for transportation, thinking that we were just going to have this normal start to the school year. When we went back and did some surveying a couple weeks ago, we were closer to the 400 number of students. So we'll be surveying families if this is the direction for step 3 and step 4 that we move forward with. We'll be surveying families for preferences of AM versus PM transportation, and more so just some options that will exist with regards to both AM and PM, because they'll look a little different because of the cleaning timeframes we will need. So that information will be coming out in the next couple days after this board meeting and after some other communications. Let's see here, food service. Well, food service, oh, Craig had a question.
Yeah, just a quick one on transportation. It's difficult for me to even imagine being in Nelson Transportation's place. Do you know offhand if all of the school districts that Nelson serves are doing the start of the school year in the same manner as we are, or do they have a district out there that's going to go all in person, for example? I know some of the private schools around town, if not all of them, are going to start out in a complete in-person setting, I believe.
So Nelson's bus service operates fleets for Monona, Whitewater, and McFarland, and all 3 have different models. Whitewater being in a completely different part of the state, and Monona in kind of a different state. I can say that because I went to school there, so I'll just leave it at that. So it is a different approach in each school. And so they're adapting to the creativity that we're putting forth with AM, PM, and wanting to move forward potentially with some of the other grade levels before all are in school. So we've been working on that. We've been meeting every week since school let out like we normally do. So it's just a little different topic this summer. So food service.
We have a question from Christine, please, before we move to food service.
Yes.
Yeah, sorry, Jeff. Thank you for presenting and all your work as well. Can you explain why there's no private pay option? I know that's going to be a question that I'm asked.
Well, we certainly, with the fact that we have about 12 buses, and we normally distribute, that's the term we want to use, about 1,200 students daily. So as you can imagine, that includes some double routing a little bit in a normal day. So we're typically putting somewhere between 65 and 85 kids, particularly when we're at the lower levels, of kids on a bus at a time. We're talking about almost cutting those transportation opportunities down to a third of the bus's capacity. So we will need to look at just the opportunities of what the minimum requirements are, probably by state law. And that is providing transportation to those that are 2 or more miles away or in unusual hazardous transportation zones. That's based on the data that we have right now. If we receive more information that allows us to have more space available, we can always come back and start opening up more opportunities.
Gotcha. Thank you. Thank you. That explains a lot.
All right, food service. We've had some experience with our step 1, step 2 virtual as we operated food service from later in March until the end of June, offering both breakfast and lunch. We did have a couple different locations when we first started that programming, and we ended up with programming out of the high school. It would be available for both paid and then reduced and free families and students. When we moved to step 3, hybrid blended, again, we would be doing breakfast, lunch, each facility operating in a blended model. If a school is still in a virtual setting versus one of the other schools, we can still do curbside pickup. We would look at a grab and go still, so that there would be no opportunities for eating at the school, but they would be taking home their breakfast and lunch for whether it's the next day or that current day. So that will be our plans for food service. Might be the easiest thing we get to plan. Yes, Craig.
Just curious as to how many folks were we able to serve in the March through June timeframe when we were doing the breakfast and lunches out front of the school?
Well, I certainly can give you the range. We went from probably about 120 students to our peak of about 485 students for a couple weeks, and then back down into about the 200 range. Now there again, that's when the USDA was operating a free-for-all program. So all meals that were provided were reimbursed by the federal government through the USDA, which operates the National School Lunch Program. They have not come back with a change in that model or bringing that model forward for the fall. So the model for the fall would be paid, free, and reduced, similar to how a normal school operates. So that will offer some different levels of probably the amount of people that participate, particularly on a curbside pickup.
Technology, I think we kind of covered this earlier a little bit, that we do have the devices, K through 12, both iPads and Chromebooks. We've talked about the Canvas platform for students and families, and we've also mentioned that there's plenty of support and access for and opportunities for parents if they need help as we progress. This is certainly an interesting slide because it kind of takes a look at kind of the United States in whole, of what it might be for a average school district, which we'd be from a size perspective much smaller than an average school district in size, because this is for the whole nation. And you know, if you had to pick the different spots from the orange, the green, the blue, and the red, we would have some of those additional incurred costs. But if someone were to say, on average across the United States, what's going to be that extra cost that'll be above and beyond probably a normal operating budget, might be closer to about $1.8 million of additional costs. We're certainly not looking at an additional 1.8 million in costs. And at this time, I don't have a firm estimate of where we might end up. We've certainly invested a little bit with our nursing services, and glad to have some people joining us back. We've certainly invested heavily already into PPE and cleaning supplies. We were doing very well with technology for a long period of time, but we certainly have some challenges right now with some activity we had on our network that we're having to add some additional expenses. So we'll continue to have more expenses, but it's certainly not going to be this 1.8 million. That is from the School Superintendents Association, the nationwide organization. Craig?
So this would probably mean that we won't be returning any property taxes to people in the village, as some have been wondering about on some of the social media, because we're saving so much money during this trying time?
I'm certain that the operating budget for the 2021 school year at this point will not have any particular savings. There might be some opportunities to look at, and certainly with us not running summer school, that has some changes for us and some impacts that will affect our future years as well.
Mm-hmm. I was being a little facetious, but thank you very much, Jeff.
Yep. I think my colleagues wanted me to get a little bit of my spreadsheet mayhem in here a little bit about, you know, for a while they were trying to figure out what would it take, you know, for 20 days for each of our children, if they're all in school, how many wipes we would need. And we put some numbers to whether that was 1 wipe per day or 3 wipes per day in 20 days or 40 days. And you can see that, you know, if we weren't using any spray sanitizers or any other applications, we would certainly have the need for almost 290,000 wipes, like a Clorox wipe. If we were to think that a child would use, we would need 3 per child during a day for wiping tables or desks and that. And then if you cross over to that and look at how much hand sanitizer, we could be looking at almost, you know, 460 gallons. So, you know, when we think about procurement, we have been putting the numbers to this and using data to try to drive how much product we need available for the first 20 days, the first 40 days, and then making sure that we know we have a supply chain that will be able to respond. But this is based on if everybody was in school for 20 or 40 days.
Thanks, Jeff. And then we've got Paul Ackley with us to talk about athletics and co-curriculars. Paul, thanks for waiting so patiently, and there's been activity, a lot of activity on this front, even up to the end of last week. So we'll turn it over to you for some discussion about how we're going to handle athletics and co-curriculars in our unusual start to the school year.
All right, well, thank you very much. Appreciate the time as always. Just recently on Friday, I think last week, I was able to update the board in regards to the WIA decision that was made on, in the past few weeks in regards to schools delaying the start of their fall sports, with our low impact sports having the opportunity to start on August 17th and our high risk sports in the fall starting on September 7th. That was one of the options that we talked about in regards to the WIA. We also talked about our public health department of Madison and Dane County having guidelines within Dane County and the Dane County schools. Many of the schools in the Badger Conference and in the Big 8 Conference chose to delay or postpone the start of their fall seasons to a modified spring season yet to be determined. I kind of described it as a 4-piece puzzle, that it was the WIA, the Public Health Department, our conference, the Rock Valley Conference for the majority of our sports, but then also the Badger Conference for some other activities and sports that we're in, and then also our school district. Well, another piece.
Like
our
Paul,
conference
there we
is,
go.
oh, is everybody all right?
We lost you for just a second there, Paul.
Okay.
I think you were just about to describe the Rock Valley decision from last.
Yeah, sorry about that. So another piece of the puzzle, of that 4-piece puzzle, was filled in just last week on Friday. The Rock Valley Conference decided to postpone all fall sports to a spring season. And so that season would start after the conclusion of the winter season. And then the traditional spring sports would then start up at the end of what we're considering a modified fall season. And one of the points of emphasis was that more than likely all of the seasons, the winter, fall, and spring, will need to be modified in some way, shape, or form in order to allow our spring traditional sports not to be impacted as much as they have this past season. That was a strong sense of our superintendents, principals, and athletic directors, that we want to do everything we could to try to maintain 3 sport seasons for our student athletes to the best of our ability, but also have in mind that we did have a season that was totally canceled last year, and we want to be cognizant of that fact. So that was the decision that was made in regards to our fall sports, in regards to our conference. We're still waiting on some guidance from the WIA on what that's going to look like in the spring. How are they going to guide us in maybe some dates in which we can have activities? We'll be meeting as a Rock Valley Conference Athletic Directors Group, the 10 schools in the Rock Valley Conference, in regards to how is that going to look. And again, we will just have to travel down this path together in regards to a winter season. We can hope and pray that our winter seasons are not going to be impacted, and that we can get our kids back into an academic setting, into our schools, into our hallways in some way, shape, or form, and then also be able to provide them some opportunities in their sporting events in the winter season. Unfortunately, we talked a little bit about this too. Our middle school fall sports have been canceled to prevent the mixing of students across cohorts. And so again, we're looking at the middle school sports of co-ed cross country, and that includes 6th, 7th, and 8th graders, middle school volleyball for 7th and 8th grade girls. And then we also have a middle school dance program for our kids through 6th, 7th, and 8th grade. And so that's been canceled for the upcoming season, or calendar year, I should say, or school year. And the one thing we have to remember with middle school sports is their seasons are shorter. So when we start our middle school boys basketball on October 19th, we're going to have to really look at, are we ready to start that season at that time? I'm also meeting with some area athletic directors for middle school athletics to discuss opportunities that might present themselves at a later date. Mr. Finstead talked about some of our Wednesday opportunities for our clubs and activities. which will allow our kids to be able to connect and have those social emotional opportunities for learning. And then obviously our communication is huge, as through our athletic department, our head coaches, our administration, that we can continue to move forward to the best of our ability, following the guidelines of our public health department here at Madison and Dane County, and then also our conference. So kind of in a nutshell, that's where we're at. We'll be wrapping up a lot of our summer activities this upcoming week that we were able to implement throughout the summer with the support of the school board. And then also, I know the MRAP through Alicia Fix and Stu Schaefer are going to have some possible additional opportunities as we start to move forward into our gradual opening of our schools.
Thanks very much, Paul. Appreciate that very much. With lots of moving parts here, Paul's been just on top of all of it all the way through the summer, and has really been a great advocate and continues to be for our students. And so even as the opportunities for the fall have kind of dissipated due to the public health conditions, he's working very closely with colleagues to try and create opportunities for kids to the best extent that we can. So Paul, I just want to recognize that and say thank you. And I see Craig has a question for us.
Yeah, that as in terms of the athletic activities throughout the conference and the WIA for that matter, that's pretty clear at this point. But how about those other extracurricular activities that we have? The drama, the orchestras, the debate, the math club, all of those other sorts of extracurricular activities that may be in some ways, you might have an ability to continue those sorts of activities on a case-by-case basis. Just wondering, what attention has been given to all those other extracurricular activities, other than the athletic side.
So we certainly recognize the value of all of the extracurricular and co-curricular programming that we do across the district, and the value that brings to students and families. And with respect to the activities that are not the WIA sports or middle school sports, but on the number of the things that you mentioned, starting right away as school begins, clubs that are able to and activities that are able to meet virtually and remotely can certainly do so. You saw in the slide that the high school put together that the graphic of their schedule, that Wednesday block is dedicated as activities day. And so, you can't do everything, but you can do quite a bit remotely. As opportunities for in-person engagement increase, we're starting with a remote learning, McFarland virtual learning plan, which is a remote learning based plan with limited in-person supports. And so those are very limited numbers of in-person engagements. As those grow, you should expect to see the co-curricular opportunities in person grow along with that. So really in proportion to those types of things, an opportunity you should see that move in proportion to what we do in the classroom in terms of in-person work. But certainly we want to be able to afford our clubs and activities every opportunity to stay active that we can.
Andrew, could I just add one more thing, please?
Please.
I just wanted to just thank Kristen Strong and Allison Potter for their hard work in regards to this summertime activities. Like Jeff Mahoney said earlier, it was, I'm not a health professional. I'm a coach and I'm an athletic director. And I just am so thankful that I can rely on our health professionals in our district to be able to kind of guide us through these times, to know how to communicate with athletes and coaches, how to communicate with parents when it comes into situations like that. And there's been a lot of people that have been thanked today, and that's rightly so, because there are so many people in this district that have put in hundreds of hours of work this summer, to be very honest with you, in regards to making sure that we're providing not only healthy and safe places for our kids to learn, but also an opportunity for our kids to get exercise, be with their friends, and have that opportunity this summer. So I just want to say thank you to Kristen and Allison for that guidance throughout the summertime. It was very much appreciated.
Thank you both very much. So that is our report for this evening. That is easily the longest superintendent's report that I've ever given. Thank you very much to everybody for hanging in there with us. It's come up a number of times, but clearly you can see we have a fantastic administrative team and health services team here, and I just want to say thank you to everybody on my team with whom I get to work every day for really tackling some really difficult challenges here that schools all over the state and all over the country are taking on. And I'm very fortunate to be able to work with such great people, and we appreciate our school board very, very much, and the support and guidance you give us, and the questions you ask us every time we meet very clearly speak to the priority of student learning and supporting our staff and our families. So we appreciate that very much. And with that, if there are no further questions, that'll conclude our report for this evening, and we can move to our action item.
Okay, next is action on designation of restricted fund balance for ending fiscal year 2019-20. Administration recommends approval of the following restricted fund balance for the ending year 2019-20. You want to go through all this, or how we want to do that?
Yeah, go ahead and read for the record here.
Okay, restricted fund balance, CTE funds of $115,610.88. Transition incentive $1,785.58 for a total 10B-936130 is $10,785.58. Do I have a motion to approve?
So moved.
Thank
I'll
you, Craig.
second.
And Ann?
Yes.
That was it.
Okay. Thanks, Ann. Any questions or comments? Hearing none. Motion from Craig, second from Ann. All in favor, say aye.
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 Opposed? Passes by a majority. Board goals.
So tonight, with the detailed report on our how we're going to reopen school, I don't have anything specific for the board goals, other than hopefully you see these priorities reflected in our planning efforts. Certainly with diversity and equity, our attention to providing supports for students who are in most need of them. We've been communicating very closely with our staff and our parents to try and reach the best planning solutions we could for the fall. And as far as district and village collaboration, we're in communication regularly with the police department, as we talked about last week, but also with Mr. Schinke, my counterpart at the village, just to keep each other apprised of our plans and how those things will impact village considerations as well. So nothing specific on board goals tonight, other than the hopefully you see them reflected in our planning work that we presented earlier.
So I go right to board comments then. Anything the board would like to share? Well, I'd like to say something. I tell you, I've been listening to a lot of people all over and trying to figure out what's going on and what's going to happen, and all the virtual kind of the bad experiences a lot of people in the virtual school when the virus came upon us. But I was extremely pleased with our school staff for as much work as they've done, and how I think this will really kind of gel. I think they put a lot of time into this. I think they looked outside of the box a little bit and made things happen. And I can see how well of a team they worked together on this and how they put this all together. I think we got a good shot. I feel a lot more confident now than I did coming in. I did not know what to expect. And I was impressed. That's just my feeling. I was truly impressed tonight. So that's my comment. Anne?
Well, I would like to echo that, Arlen. I think the administrators have done just a yeoman's effort in trying to create plans that meet the needs of our school children while taking into consideration issues that are facing parents, as well as the teachers that are distributing what is so necessary to our kids, and that's their educational framework, whether it's academic or social emotional. That's just so important. And it goes without being said that this is a bad situation given the pandemic, but I think you guys have done the best you can with the bad situation that we're facing, and you should sleep good tonight because you did well.
Yes, exactly.
Thank you.
Spoke well. Craig?
Yeah, I'd like to echo Ann's thanks, of course, but I'd like to add, along with that, I wanted to thank all the community members, staff, all the folks that have reached out to whether it be Andrew and the administrative team or the school board, or all inclusive. Without that feedback and without that engagement, I think this decision would have been just that much more difficult than it already is, realizing full well that not everybody is going to agree with the position or the plan that we've decided to move forward with, but for the very, very most part, all of the communications and all of the emails have been well thought out, and wanting nothing more than what's the best for our kids here in the community. And I think over the years, our administrative team and the school.
The other board members have said, I think a lot of parents or community members, certainly the children, aren't going to realize how much work is going in to try to make the best out of this situation. It's not a good situation. I think everyone realizes that. And I too have received a large number of emails from parents, primarily some teachers and some community members. And they have varying opinions, but there's one common theme, which is they're all very polite, very well-reasoned emails. I really feel that when people make their arguments in rational and well-reasoned and polite, courteous emails, I'm just impressed with our families. It's such a hard time for them. Passions are running very high, and I think we're an easy target to unleash some anger, but I haven't seen it, so I'm very thankful for that. And again, just thank everyone for this. And I know whenever we do referendum questions, there's invariably one or two questions about, well, why don't we just cut some administrators? And I think tonight you can see where administration is very, very helpful, and we couldn't do this without our administrators. So I want to thank you and thank all the teachers when they come back. They've got a heavy load that they're going to have to carry, and hopefully next year at this time it won't look like this at all. Thanks.
Thank you, Tom. Much appreciated.
I'm just going to say ditto so that we can get off the call. No, seriously though, I do want to say thanks to everybody and just know how much you are appreciated. I agree with Tom in that in the emails, people are very appreciative of all the hard work that you're doing. And I'm not sure people are aware of all the behind the scenes extra hours, extra unpaid hours that are being done right now. So personally, as a parent and as a board member, I want to thank you.
And that note, thank you guys for hanging in there tonight. It's been a long night. We've been meeting every week and it gets to be a challenge, and I know it does. So I look for a motion to adjourn.
I'll move to adjourn.
And
I'll second.
Christine. All in favor, say aye.
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 We're adjourned. I don't have a watch.
10:40.
10:40.
Thank you very much, everyone.
Yeah,
Great job
thank
tonight.
you. Yes.
Great job.
Thanks, everyone.
Absolutely.
Thank you.